Perfect. Okay. Well, my clock says it's 5 o'clock, so it's time to start our meeting. So we'll have a call to order as the first thing, and then Dr. Buchanan, are you in charge of our roll call today?
I am not. Narda is on and she'll be doing that and doing voting as well.
Okay, thank you. So Narda, if you will go through a roll call for us.
Certainly. Dr. Drake,
Here.
Dr. Gotcher,
Here.
Dr. Hurt.
Here.
Mayor Jacobs.
Here.
Dr. O'Brien,
Here.
Dr. Shamia,
Here.
Dr. Sousa,
Here.
Ms. Wagner,
Present.
and Dr. Buchanan.
Present.
So I believe we have everyone present and therefore have established a quorum. And the next order of business is going to be approval of the minutes from the September 9, 2020 meeting. This has been distributed to everyone. And in general, if there are no calls for additions, corrections, substitutions, we can accept a motion for approval and a second, and then we can discuss it further if you would like.
Motion to approve.
We have a motion, second.
Second.
Second, any discussion on the motion and second to approve the minutes of September 9, 2020? Hearing none, we can call for a roll call vote. So Narda, if you'll go through the roll call for us again, please.
Certainly. Dr. Drake,
Yes.
Dr. Gotcher,
Yes.
Dr. Hurt,
Yes.
Mayor Jacobs,
Yes.
Dr. O'Brien,
Yes.
Dr. Shamia,
Yes.
Dr. Sousa.
I'll abstain since I was not present last week.
Okay. Ms. Wagner,
Yes.
Dr. Buchanan.
Yes.
Thank you. 8.
8-4 with one abstention. So we have approved the minutes from September 9, 2020. The next item of business is to set the agenda, and you should have before you or distributed to you a copy of today's agenda. In general, any quick general discussion about it, and if there is none, I'll accept a motion for approval of the agenda in a second, and then we can discuss it further if you like. And unmute Dr. Drake.
Okay, all right. I make a motion that we accept the agenda for today.
And a second, please.
I'll second.
Any discussion on the agenda?
The only thing I may want to bring up is we have guests with us to allow them to speak at the same time in the educational institution presentation, Mayor Kincannon and Chief Thomas, if that's possible.
I think that would be fine if it's okay with the board. It's certainly fine with me. Any other discussion on the agenda for today? So we have a motion and a second. And Narda, if you want to go through the roll call for us again.
Yes. Dr. Drake,
Yes.
Dr. Gotcher,
Yes.
Dr. Hurt,
Yes.
Mayor Jacobs,
Yes.
Dr. O'Brien,
Yes.
Dr. Shamia,
Yes.
Dr. Sousa,
Yes.
Ms. Wagner,
Yes.
and Dr. Buchanan.
Yes.
Thank you. It passes 9-0.
Thank you. You have adopted the agenda for tonight's meeting. So with that in mind, the next item on the agenda is item number 6, which is the Knox County Health Department benchmark presentation by Dr. Buchanan. So Dr. Buchanan, if you would like to proceed.
Sure, thank you, Dr. Goetcher. So while Danielle's pulling up, or Catherine is pulling up the benchmark presentation, we had 66 new confirmed cases today, since yesterday. A total of 8,656 confirmed cases of COVID since March. Additionally, we have 327 probable cases. 6,892 of our cases are considered inactive, giving us 2,024 active cases. 315 individuals have been hospitalized at some point in their illness. 29 Knox County residents are currently hospitalized. Unfortunately, we do not have any further deaths to report today, so keeping our total of 67. So our first benchmark, sustained reduction or stability in new cases for 14 days. Last week, we saw 5 consecutive red flags. This week, we have seen 2 red flags. All of this indicates statistically significant increase in cases. Because of this, we are representing this benchmark as red. Our second benchmark, community-wide sustained and increased diagnostic testing with consistent or decreased test result reporting turnaround time. Over the 14-day evaluation period, we did have a 3-day red trend in lab turnaround time. But since September 4th, it has remained around a 2-day average. Regarding testing, we saw some consecutive red flags for the number of tests conducted, but overall, the number of tests conducted week to week continues to trend up. We believe the increase in turnaround time and the decrease in testing were related to Labor Day weekend. However, we are still concerned that folks are not getting tested when they should be. Because of those factors, we're representing this benchmark as yellow. On our third benchmark, sustained or increased public health capability. For this benchmark, we aim to initiate investigations for new cases within 24 hours and for close contacts within 48 hours. We've added a few new team members into our EPI support team from last week. With this team, we continue to be able to initiate investigations in the desired timeframe. Because of this, our benchmark continues to be represented as green. Fourth benchmark, healthcare system capabilities remain within current and forecasted surge capacity. During this timeframe, we saw red and yellow flags noted for ICU beds and ventilators. 2 yellow flags were also noted for positive inpatients, but they were not on consecutive days. After speaking with our hospital partners, they stated their benchmark should be represented as yellow. Our fifth benchmark, sustained or decreased COVID-19 related death rate for identified positive or probable cases. Over the past 2 weeks, we have seen 11 deaths. The information available leads us to represent this benchmark as yellow. And Catherine, do you have those, the detail on our trends ready? Okay. So last week I shared some data about who are our new cases and where are we seeing those increases. We continue to see most of our increases in school-aged children and up into college-age young adults, with the 18 to 22-year-old group having the largest growth over the recent past. 656 cases between August 30th to September 5th, and from September 6th to the 12th, 335 cases. And so that's a pretty significant increase. And you can see from this graph that that blue, I know there are 2 blue lines that look about the same, but that top blue line is the 18 to 22-year-olds. And then you can see under that are kind of the 41 plus year olds, but you have to remember that includes a whole lot of people, because that includes anybody. I mean, that's probably everybody on this call is included in that group. So the 18 to 22-year-olds are really the lion's share. And right behind them are kind of high school age kids, and then middle schoolers. Catherine, you want to show the next slide, please? Or next graph. So these are school age kids in elementary, middle, and high school. And again, you can see if you look at the which is not the x-axis, the range is smaller with this graph, so don't be confused by that. But you'll see that the high schoolers are really where most of our cases are in Knox County, and Lisa would agree that that is certainly the trend that we're seeing. So it's really that 14 to 22-year-old age group where we're seeing the most cases in our community. So I just wanted you to have that information. Any questions about the benchmarks or the data I just presented? Oh, and sorry, one more thing. If you look at the Tennessee Department of Health, they have a page that looks at doubling time across the state. And right now, Knox County by far has the highest doubling time for any county in the state. So doubling time means how long does it take us to double the number of cases that we have. And our doubling time right now is 39.6 days. So a low number is not a good thing. That compares to the next closest is, and I don't know which county it is, but is 50.2 days. So we are doubling our cases quite rapidly. It is in this younger age group, but we are doubling our cases, and that's concerning to us as well. So now I'll take questions.
Dr. Buchanan?
Yes.
Can you flesh out what's happening or what happened with the testing, please?
So Catherine, can you pull the testing back up? So Mayor Jacobs, you mean, so are you talking about why we think there's less testing? Okay.
No, with the turnaround time, and you hit a snag with that.
So we think that, and this is all conjecture on our part because we don't have communication with all the different labs, but we believe that was probably due to the Labor Day holiday and labs not running at full capacity over Labor Day. And so holding some specimens and batching them after the Labor Day holiday probably caused us some delay in turnaround times. That's what we believe is true. I'm not sure if we've asked the state about that, if they saw it across the state or if it was just unique to Knox County. We didn't really see a lag in our turnaround time for the labs that we drew, but we also, well, we were here. So we were here and getting our results. So as far as the labs we use, we didn't see that, but we did see it across the county that there was some delay in turnaround time around that time frame.
Thank you.
Sure.
Any other questions or comments on the Knox County Health Department's data for this week? If not, Dr. Buchanan, thank you for that presentation.
Welcome.
And next on the agenda, number 7 is University of Tennessee Medical Center's Knoxville data by Dr. Shamiya. Dr. Shamiya, are you ready?
I am. Yeah.
Okay.
So again, will be a lot of this will, or some of this will portray some of the things Dr. Buchanan just did in a different way. Also, I'll have just a few things along the way that I think are pertinent from, I had the opportunity to learn a few things from Dr. Burks yesterday, who was on campus, and I'm going to interject those things as I go. Next slide, please. So the hospitalization correlation to cases looks similar. No big news here. If you look at the district on the right, those circles are closer together, meaning the correlation in the upper right of that graph in the THA district, they're closer together. And what that means is that correlation is potentially stronger, which you would potentially expect because the district as a whole has less of the younger age group than Knox County specifically does right now. And we know the younger are less likely to be hospitalized. Next slide, please. For the pace of new cases, you'll see first in Knox County, that last bar, the 8, it took us 8 days to add the next 1,000. So that's a new bar from last week, and 8 is as low as we've been for the number of days to add cases. The district, that 4 in the far right-hand side is also new from last week, 4 days to add the next 1,000. Next slide, please. And so this is just another way to portray some of what Dr. Buchanan showed, but you'll see that in the most recent week, we added 935 cases, where last week we'd had 778. So 935 is our max for a week. And you see on the right-hand side for Knox County, we are at pace to certainly exceed July and August. In the district, it's not as dramatic. Remember, I mentioned last week that, and I'll show a slide where we're really kind of driving the district, and the district is taking a larger role in the state. But you see an increase, although not as dramatic. Next slide, please. So this shows the new cases by age demographic. And so first thing I'd point out is that 0 to 10 group is flat. And I think that can be perceived as good news. Certainly you see 11 to 20 and then 21 to 30 with significant growth, which we've spoken about. And then I think the point to make on the bottom 3 tiles is that, you know, it's not that they've gone away. It's actually pretty comparable to what it's been over the last several weeks. I think that the key issue here is that if we start to see those spikes that are on the top row start to cascade down to the bottom row, that is where we will potentially start to see that translate into sicker patients and more hospitalizations. A point I'll stop here and make is that I know there's a lot of conversation about whether, you know, what should we make of the college age person, or for that matter, just specifically someone who is in college. And I asked that point blank to Dr. Burks, not because of any specific agenda. This was an opportunity for me to pick her brain, which was a unique opportunity. And her comment about that was that these people, these students are mixing in the community, and she felt that they should be approached or thought of as any other case in the community. They're not as likely to get sick and be hospitalized, but from a public health perspective, at least that was her answer. Next slide, please. So trying to this is a way to attempt, and Dr. Buchanan showed this. Actually, could you go back to the last slide, please, just real quick. So 11 to 20 and 21 to 30, at least the data that we have access to, that's the way it's broken down. And so trying to parse that out between how much of the 11 to 20 is actually people who are 12 years old versus 19 is difficult to do. So this next slide is an attempt to do that. Next slide. So if you see that the 5 to 18 has a reasonable amount of growth in the middle, on the left, clearly it's flat. And on the right, it's the 11 to 20 is rising. So I think what you can conclude from that is 11 to 20 is contributing more to that growth than the 0 to 10. And so clearly the 19 to 20-year-olds are having an impact. Dr. Buchanan's data showed that as well. Next slide, please. So this is our doubling day growth rate. All I'll point out is on the bottom right of the graph. You just see it starting to, the descent seems to be flattening out, and the lines are close to crossing. So that's the sign that that the doubling day growth rate would start to rise on this graph, which is compatible also with what Dr. Buchanan said about what our current growth rate is. Next slide, please. So this compares us to the other counties. I pointed this out last week, so it's not brand new, but you see that Shelby and Davidson have had at least 1 week spikes. We don't know to what extent that's going to persist. Hamilton on the way down, and then that's just the same graph I've already showed you of Knox County. Next slide, please. So this is something new. This shows the entire district as a portion of all of Tennessee's new cases. And the red dots are a 7-day moving average, and the blue is the actual daily percent of cases. And so what that shows you is that certainly in the beginning of this, it was all Middle and West Tennessee that were driving, but The THA Knoxville district, as it's defined as those counties, has an increased proportion of the entire state's new cases. Next slide, please. So then on hospitalizations, here you see that Knox County, these are new hospitalizations. So in the past week, it's very comparable to what it was the week before. You see that September is on track to, it would seem, exceed August, but would not appear to exceed July. And then the district, you're actually, this time it's more accentuated, but again, you would think that there's more of the at-risk population in the broader district, relatively speaking, than just in Knox County based on what we've seen about the recent cases. I don't think it's probably not useful to overthink this. I mean, you can try to explain anything. So, key being is just the data is the data. Next slide, please. So Dr. Buchanan mentioned Labor Day and the possible issue with testing. We also noticed definitely a reporting issue from hospitals around Labor Day. And remember, this is the census. So this is the number of people in the hospital in all those counties on all these days, whereas before it was new hospitalizations. Next slide, please. The projections that and remember, this is kind of just basic of taking the graph in total and then just projecting it out. When it was on a sharp rise, we were projecting it close to 400. And here you see the last 3 trend lines. September 2nd is in yellow. The pink is September 9th, and September 16th is the blue, which I just showed you. This was the other piece where I specifically asked Dr. Birx and about just the significance of this, and we've said in this meeting multiple times that this is the most lagging. This and mortality are the most lagging metrics. So what we do today may affect hospitalizations, not today, not tomorrow, but 4 weeks from now. And if this rises, our ability to get out of that is also going to take several weeks. And Dr. Birx told me that this was probably the last thing she looks at, or the least thing that she emphasizes. We're focused on it, and I'm certainly focused on it in my role, because we want to make sure that we have, as a community, the hospital capacity to take care of sick patients. Next slide, please. So what she did say in that really is a focus is the positivity rate. And we've talked about that. Actually, I think this is a little bit more understandable than what I showed last week, but showed last week a graph of that. And this is what, for example, the White House Task Force uses. And we've had Dr. Buchanan has raised some concerns because we may not be we're probably capturing most of the positive tests, but may not be capturing all the negatives. And so, for example, if you see that 10.2% spike on the left-hand side of the graph on that positivity rate, that may have been related to some of that issue. So there may have been some unreliability at that point. But what I see here as something potentially useful going down the road is the trend of this I find to be much more reliable and helpful. And so you see how we did have a positivity rate in the left-hand side of 2.2 to 3.9%. And then even at a point where we really thought things have settled down, didn't drop below the kind of 8%. And then we've seen this recent spike, which we have spoken about. The other thing that she emphasized is the importance of testing volume. And I've mentioned this before, but I think most people think about test positivity rate as simply, oh, wow, when that number's high, there's a lot of people with COVID, so it's not a good situation. But that's part of it. But the other part of it is this is an indication of how well the community as a whole is managing the disease. And a lot of that is about testing. So the more testing you do, the more inherently you're going to drive this number down. You're going to dilute the positives with negatives. But from a public health perspective, as you're doing contact investigation and trying to isolate those who have COVID-19, that's exactly what you want to do. And so this is why I think she focuses on this more than anything else. And so this might be something that we can continue to talk about, but I just really wanted to show more visually where we are right now and then explain it just a little bit. And then my final slide, next slide, please. So I tried just to summarize just factually what I've shown. And so we've had 3 weeks of increasing case growth. The highest weekly total of new cases since the beginning of the pandemic has been in this past week, but it's driven, and it is driven by the 11 to 30 age group. The 0 to 10 age group shows little to no signs of new case growth acceleration at this point. Those over 30 are still being diagnosed with COVID-19, and that hasn't gone away. It's actually pretty stable. It's about 36% of all the new daily infections in September. And remember, I mentioned that about whether the younger group is going to cascade down. District hospitalizations are increasing, but certainly not at the same rate. Knox County new hospitalizations remain level and manageable. And so I believe that's my last slide. I'll be happy to answer any questions.
Dr. Gocher, may I have a quick question, or actually just a comment.
Yes.
Your slide on the the percent positivity rate after hearing from Dr. Burks, I came back to my staff, and we are working on trending that out. We'll be using the state's positivity rate because they publish that regularly. And again, using it for trending, not for, that's absolutely that the number is wholly accurate, but if the trend is up or down, that's helpful for us. And one of our challenges, and that we really don't know how to fix, is decreased testing volume. And so we're seeing it, our other places are seeing it as well. So that concerns us for lots of different reasons. One, we certainly have cases out there who don't know their cases and are walking around making other people sick. And it just doesn't give us a good idea of disease burden in our community. So we kind of lose that ability to see what is the disease burden in Knox County. So anybody has any bright ideas on how to increase testing, we're open to it, but we haven't come up with any.
Well, Dr. Burks did mention that, her number one concern about Tennessee, I believe she said it was her number one concern, certainly a high concern, was that the testing volume has dropped substantially across the state. And, she's certainly more of I feel comfortable talking about these things, but she spent her entire career doing this. And I think that, the one thing, Dr. Buchanan, that I've thought through is that if there is a way, the one thing about positivity rate is that it may be a metric that gets us rowing in the same direction on this, because if that is felt to be extremely important, it really doesn't just motivate people to quarantine or to wear their mask, but it motivates testing. Mm-hmm. And so, but even if that's not the case, I think that the other thing that we think about from a hospital side is a unpleasant surprise, right? Mm-hmm. When cases increased the last time, it just seemed to come out of, I wouldn't say nowhere, but it really accelerated quickly. Mm-hmm. And so the less of a handle that we have on who has COVID and which age groups have COVID, the more likely it is that from a healthcare infrastructure perspective, we could get surprised, which is the last thing that we want. Because remember, it takes us several weeks to reverse that. It's not something that we would just do overnight.
Right. Actually, Tennessee's testing volume had decreased by 50% in the recent past. That was one of the really cool things to be able to hear from Dr. Burks, was she and her staff have they have like the nationwide view, so they can really look and say, here's what these places are doing, and these are the things that worked. And that's really helpful to hear, because this is a new virus and we're responding to something without having a full knowledge of what's the best thing to do. So that was really helpful. And she also mentioned that West Virginia, and I haven't looked at it yet, is using a red, green, yellow, red, green, yellow traffic light kind of thing to talk about how things are going in the community and connect that to if we as a community are in red, there's no football. And that's worked for them. I think mostly speaking of high school football, but she said that's been something that's worked. So I haven't had time to look and see how they're doing that and what that looks like. And if that's something we would want to consider looking at as a community, really motivating people to take responsibility and say, hey, if we want to have these things, we have to do this other stuff to reduce risk. So again, we've talked about trying to motivate and change human behavior. And so that might be one way to do it.
Any other comments, thoughts on the UT Medical Center presentation? Dr. Shamia, anything else to add to the discussion?
No, sir, not for me.
Okay. Well, we always, as always, really appreciate the thoughtful work that goes into that. Appreciate your presentation. Next on the agenda is our educational institution presentations. And first we'll hear from the University of Tennessee, Dr. Plowman and Dr. Gregg. Thank you for participating.
Thank you. I'll start and then let Dr. Gregg chime in when he wants to. I want to do two things tonight. Let me just clarify a little bit about Dr. Burke's visit, and then I want to talk about our numbers and our testing. So Dr. Burke's office reached out to us on Friday. She is sweeping the country. She's been to 28 states. She and Dr. Aram Zaida, who is an epidemiologist, are driving all over the country. And since universities have been back open, they have made a point to visit the big flagship universities in kind of college towns everywhere. And she's now visited 6 in the SEC, and honestly was very complimentary of the SEC, more so than schools all around the country. I like that part. But she's got so we had 2 meetings with her. One was a meeting with my team, leadership team, just where we could talk about our numbers, our planning, our testing approach, our challenges. It was a wonderful, wonderful conversation. And then she asked for a meeting that included stakeholders. And so I was so grateful that Dr. Buchanan, Mayor Jacobs, Mayor Kincannon, and Dr. Shamaya were able to come, really representing the larger community. And she basically, and I'll speak at the end of this about her comments as they specifically maybe relate to our situation, but she very much affirmed the preparations that we've made, our planning, our adjusted planning, our continuing adaptation. We described our expanded testing strategy, which I want to share with this group tonight. And she was very supportive of that, had some ideas about it too. And really was able to share broad trends, best practices. She's been to every major university just about in the country. And she said there's kind of a buzz about it now. The other UT called her and they want her to come there. So she'll be going to Austin, Texas, I think later this week. So let me talk first about our data. So I believe that someone is here who's going to pull up my slide. So I want you to take a look at the slide that represents cases as of yesterday. So I'm trying to breathe and not to get too excited, but I'm very happy with the look of that curve right this minute. Now, what happened there? So that number now, as of late yesterday, that's 499 active cases, 486 students. 182 students dropped out because they've recovered, they've gone through their 10-day period. So yesterday, we only had 24 new cases reported. So that, is one of the things we want to see. We know it's going to go back up again because we're going to do some testing that we haven't been doing, and I'll speak to that. But for today, I'll take that. That's really, that's good. The next slide shows you the other things that are on our website, and you can always look at them. This is the total number of students in isolation. We are really concerned about the number of students. That number there today, as of yesterday, was 1,784 people, 1,684 are students. We have a total of, I think today's number on employee is 13 employees, 1 faculty member, and 12 staff members. One of the things we've noticed is that as children have gone back to school, families are being affected with, and that's pretty much explains most of our employee cases. We've had no cases traced to a classroom or to an office situation. The next slide will show you again, just really quickly, why people are isolating. That wheel doesn't really change. The biggest one is always because they're a close contact, and that's our quarantine number. So as I told you last week, we made the decision to empty out a dorm and create an isolation dorm. So we emptied out Massey Hall. I think the last of them left today. And that's the first time we tested every person in that hall. Up to this point, we've been following CDC guidelines and testing people with symptomatic symptoms, and then students who are close contacts. In this test of every single person in the hall, we found a 7 to 8% positivity rate. These are all asymptomatic students. So they've all been moved to isolation spaces. Their roommates, if many times the roommate was also positive. If the roommate wasn't positive, tested negative, that roommate is now in quarantine. So that's our first look at, speaking of the positivity rate that Dr. Shomea was talking about a minute ago. We hope that that is higher than other dorms because that we had the most students voluntarily come to the health center for a test from that dorm. So our testing strategy going forward, our next question is, how representative is Massey of our whole campus? We are doing wastewater testing of all the buildings on all the dormitories and Greek houses on campus. Those first collections have been made and the results are in. I haven't seen them yet. The wastewater testing is going to help us follow trends and see where there's the intensity, where there might be the most cases, and where we then need to move in with a different level of testing. We talked through this with Dr. Burks, and she was very affirming about that. She said many of these schools who tested everyone on day one, I mean, in a lot of ways, what happened to them since is the same thing that's happened to him here. Then the spike came later after kids have been around each other. So she was very affirming of our approach. In addition to doing the wastewater testing, we're now going to test another dorm that is similar in style to Massey's, meaning communal bathrooms. It's more of an old style dorm. And we're going to go in there with pooled saliva testing. And this is all being done by faculty who converted a couple of their labs to be able to make this work. We'll do pooled saliva testing to see where there are concentrations within a dorm, and which may then send us in to do finally individual PCR testing. In addition to that, we've selected another dorm on campus, which has a different style of living. It's not communal baths, it's more apartment style. And we'll be doing PCR testing in Magnolia Hall. So this is our first rollout of our really systemic, broad scale testing of the campus. It coincides with a 14-day kind of pause breather we took effective last Thursday. No indoor activities. We pushed everything out of doors. All the food is grab and go. Students are in their dorms. They're required to stay in their rooms and not congregate with each other in other rooms. This has been hard for students, but I want to tell you their resilience has been great, and their acceptance, and to call it positivity would be an overstatement, but their acceptance and willingness to go with this. We're really focusing on trying to build a wall, if you will, around the on-campus dorms. So we were thrilled to be able to talk through every bit of that in more detail with Dr. Burks. Got some good suggestions. We're going to do an additional research project of kids in quarantine that we haven't, to just find out, do they really need to stay there 14 days? And that will be really important. If the quarantining has just tied us in knots in a way. And we're now, through the help of Dr. Buchanan, working with Dr. Gregg, have refined our procedures to where students can quarantine in, these are close contacts, in their room unless the roommate has a underlying conditioning or that kind of thing. In summary, let me just say that it was wonderful to meet with Dr. Burks, who's been to so many campuses, and she could share with us what they're doing at other places. Can you all still hear me? Have I frozen up? Okay, all right, good. And 28 states. And the things she said she has seen across as she looked at how the South has started to bring their numbers down, two things made a huge difference everywhere. And that is continuing the mask mandate. She immediately complimented us when she walked in the door she drove around campus, all the students had on masks. And I was grateful to hear that because we hadn't given them a forewarning. It was a surprise visit. Continue the mask and eliminating the consumption of alcohol after 10 o'clock at night. She said 10 o'clock, 11 o'clock, close the bars. One of those three, that in combination with the mask has driven the numbers down, and you can change your numbers in 8 weeks in a large community. So it was really wonderful to have her here and just to hear her insights. She's met with governors, people at the county level, the state level, in 28 different states, and university leaders. And so we were fortunate. I'm grateful for my colleagues who were on this call who were able to come yesterday. I think we all learned a lot. I left there feeling inspired and grateful for the work that she's doing, just state by state, city by city, university by university. So I'll close with that.
Thank you, Dr. Plowman. Dr. Gregg.
So I was certainly pleased to be there yesterday with Dr. Burks and to be involved in the discussions that we had with her. I am, as Dr. Plowman is, I'm concerned about the numbers that we've recently seen here on campus. Our goal is to make every effort to keep the campus open, keep our students here. We don't want to be sending our students back home with illness. So I think that as we continue to remain here on campus and students are participating in activities throughout the community, that it's going to be important that we try to mitigate as best we can activities that they may be involved in that could take that spread further out into the community, and especially to our more vulnerable populations. So anything that the Knox County Health Board could do to help us in that regard would be greatly appreciated.
Thank you. To the board, any questions, discussion on the report from Dr. Plowman or Dr. Gregg?
Again, Chairman, just a comment for the board's information. When Chancellor Plowman talks about quarantines, the thing that's really killing them, compared to a community contact who has maybe 4 to 6, or community case has 4 to 6 contacts, UT students on average have around 20. You know, we were all in school. It's a very social time in your life. And so their quarantine ratio is much higher than Knox County schools or even the general community. So if you look at those numbers, they have a lot of folks in quarantine.
Any other questions, discussion? If not, we really thank both of you a lot for your input and support for trying to control this in our community. Thank you very much. Next on the agenda on educational institution presentations is the Knox County School System. And Ms. Wagner, if you have a report for us, please.
Sure. Next slide, please. So this is kind of the same as, well, it is the same. We talk about the dashboard, and this is yesterday's. And so we have 33 students who are active cases, and 9 staff. And so today, today's totals are, we have 38 active student cases, 7 staff. Next slide, please. And if you look from September 9th through the September the 15th, it just gives you like the bars of how many active staff and how many active students. Next slide, please. So September the 15th, recovered students were 86 and recovered staff was 90. So today's total is 90 students have recovered and 91 staff have recovered. Next slide, please. So this just gives you a more detailed description from September the 9th to September the 15th of recovered cases. Next slide, please. And this is the 15th, September the 15th, with the students in isolation and quarantine and the number of staff through September the 15th. And so I'm not going to read that to you, but today's total is 842 students and 60 staff. Next slide. And this just gives you a picture of September the 9th through September the 15th, the number of people in isolations. The light blue graph is students and the dark blue is for staff. Next slide. And these are the metrics for September the 15th: student attendance, teacher, school staff attendance, and etc. Next slide, please. And this gives you the detail of what each metric means, like the green attendance rate of 93 or greater. Yellow is attendance between 90 and less than 93%. And red is an attendance rate of less than 90% based on historical data. Next slide. So I think one of the board members had a question about teacher absences versus 2019 versus 2020. So in August 2019, there were 3,060 absences. And in September of 2019, there were 1985, totaling 5045. And so this year, in August 2020, 2291, and in September, 1804. And I would like to say that these absences it really is a mirror image of last year, but the absences could be related to anything. I mean, not just COVID, but teacher absences could be related to anything. Next slide, please. And Dr. Gotcher had questions about how do we know that a student is participating in online learning. And so for virtual students, all students must sign in and participate in virtual learning lessons with their assigned teacher each day at school. And for quarantine students, all students must sign in and complete assignments provided to them through the KCS online platform. And when Dr. Buchanan was doing her presentation, she mentioned that most of the cases in Knox County schools are seen in high schools. And I just want to say that I really agree with that. So I think that's the end of my presentation, and I'll take any questions if you have them.
Thank you, Ms. Wagner. Any questions, points, discussion about Knox County Schools data?
Lisa, can you elaborate a little bit about, so the dashboard you show us and the metrics that you show us for the, I forget, the red, yellow, green stuff.
Yes.
That's for the whole district, but
Yeah.
you also look at each school that way as well, correct?
Yes.
So that can be applied to a particular school. That's one way the school system is being surgical in deciding which schools to make changes in, or even within a school, you might have, a classroom or an area that has a challenge and the rest of the school's fine. So we're working really closely with them to take a really cautious and surgical approach to making that switch from in-person to virtual. So I just think that might be important for the board to understand that it's not all or nothing.
Yes. So what we do is we have a database that has a list of all the schools, and each day that we get like a positive case, and because of that positive case, you know, we have to do contact tracing and the number of students that are quarantined within that school. And so with the database, we put the date that the quarantine starts and some formula that they have in the database. It calculates how long they are out, and so that allows us to be, you know, surgical, like Dr. Buchanan says, and be precise on the number of students that are quarantined because of COVID. So, and we do that every day, and the new numbers are uploaded at 4 o'clock on the dashboard. So we really have a bird's eye view of what's going on throughout the district. And when we see something, you know, that's not quite right, we talk to Dr. Buchanan and her staff, and they help us navigate that. So we really appreciate that very much, because we couldn't do it without Dr. Buchanan and her staff. They've been so helpful to us, especially me. With
It's a really great partnership, and we're learning stuff together.
Yes, ma'am.
Any other questions or discussion on our educational institutional?
I have a quick question for Ms. Wagner. We've talked in the past about how when a child presents with illness, either when they're starting the day at school, or perhaps they go to the school nurse during the day, it's suggested, of course, and recommended that the child be tested for COVID. And I'm wondering what kind of data you all have, if you have an idea of those children for whom it's suggested you need to go have your child tested. That's what we recommend. What percentage of them actually do get tested?
I have to get back with you on that because I don't have that right in front of me, but I will try to have that for you at the next week's meeting.
And of course, we understand, you know, the challenges for families having to come get a sick child, take them home, take them to the doctor where they're going to get tested, and you know, miss work and that kind of thing. But I'd be curious to know how, what those numbers look like. The good news is it looks like attendance is stable right now. You've not gone below that 93%. You're still in the green zone. Is that's my understanding. So that's good.
Yes, it is.
Any other questions or discussions? If not, I have a question both for Dr. Plowman, Dr. Gregg from UT, and also to Ms. Wagner at Knox County Schools. And that is, in the data you have presented, have there been any hospitalizations of any of the patients?
I'll speak for UT and maybe Dr. Gregg. I'll let him speak.
To this point, we're aware of 2 hospitalizations of students. We're somewhat at a disadvantage with not being directly related to UT Hospital or any of the surrounding hospitals. The only way that our institution is aware of someone being admitted to a hospital is if the student chooses to make us aware of that. And so we may certainly have had other students that have been hospitalized here or in other areas, maybe back at their homes, but we wouldn't be aware of that unless they choose to notify us of it.
Thank you.
And for Knox County Schools,
staff or students.
Okay. We did have one staff that was hospitalized, and that was in July. And of course, they have since recovered. And as far as the student, I'm not aware of any. I know there was a student that was in the hospital for some other condition, and they were tested, but I'm not sure. I never heard of the result. So if I haven't heard about the result, I'm assuming that it was negative.
Thank you. Thanks for your input.
Yes.
Dr. Gocher, we can't hear you, sir.
I'm muted again. I was thanking everybody for their input and presentations. Thank you. Thank you. Next on the agenda is item 9, which is COVID-19 face covering regulation, which is 2020-1 up for review and discussion.
Point of order, I believe we asked earlier if Mayor Concanon and I think is Chief Thomas also on. If they wanted to speak, they could speak now.
Oh, that would be great. Sure. That would be fine. So who would like to go first? Mayor Concanon, would you like to speak first?
Yes, I'd be happy to. First, on behalf of the people of the city of Knoxville, I just want to thank you all for your service. Every day people say we're so grateful that the members of the Board of Health are working hard to protect the public health of our community. And we know that you're all doing this as volunteers and on top of your many other responsibilities. So thank you. And also we recognize that when you're successful, it's hard to measure lives saved and suffering spared. But the mask mandate, I am confident, has made a big difference in our community. I'm really grateful that you have made that happen, and the community is really following your regulation on that. And I see it all the time, and grateful for all your communications on that. I also just wanted to say thanks to the Chancellor Plowman and to Ms. Wagner for your reports from the schools. That's obviously a county function, but I'm a parent of a Knox County school student and obviously have a long time interest as a 10-year member of the school board and in the health and welfare of our schools. Every day, it seems like every day I get an email from my daughter's school saying there's been new COVID cases. So I hope they're getting tested and I hope that they do not end up spreading it to their family and other members of the community. But I do think as much as we've been focusing on some of the stuff happening at the university level, it seems like there's some growing cases, as Ms. Wagner described, in our schools. So anyhow, just wanted a note of appreciation. I wanted to just also say, and as you get into your conversations later, both Chief Thomas and I are here. There have been a lot of community discussions about enforcement, and I just wanted to say the City of Knoxville and Knoxville Police Department are ready, able, and willing to help with enforcement of all Board of Health regulations. So just wanted to say that publicly, and when you guys get into more detailed discussions about any revisions to regulations you may choose to adopt, we're here to answer any questions you might have.
Thank you very much. Chief Thomas?
I can't add much to that other than to thank you all for the work you're doing. I know I followed some of your meetings and they've been long and arduous, and wanted to thank you. And on the other end, as a parent of a UTK student who lives on campus in a dorm, I appreciate Chancellor Plowman's input as well in all she's doing for those students. So thank you. And I echo everything that Mayor Concanon said, that we stand by ready and willing to help, and any enforcement action we can take at the request of the board. So thank you.
Thank you. Any comments, questions for either Mayor Concanon or Chief Thomas from the board?
I have just one question. I also like to ask, Mayor Jacobs' thoughts on what happened with Dr. Burks from his perspective, as well as from Mayor Concanon. And then the last thing I'd like to throw out there for Chief Thomas, and I had made a request to see if we could have the sheriff, the chief, and the chief from UTPD, at least invited. But just to say, as we go forward, we will, I think, need help. And I just want to see, can you help us? And are you available to help us?
So if you want me to, I'll go first and respond to that very quickly. Yes, and we are planning on meeting, and I'm getting ready to send out. I have talked with Chief Lane. I'm going to hopefully talk with the sheriff as well, and planning a meeting tomorrow to discuss anything that happens tonight and how we can work together to work on those initiatives and enforcement. So yes.
Thank you very much. And I just wanted to give Mayor Jacobs a chance to say something too. I like hearing from him.
Well, Dr. Burks was very complimentary of all the schools throughout the Southeast, throughout the Southeastern Conference, something that we, you know, as rivals with all these different schools, that was a little hard to take, but she was very complimentary actually of the SEC schools as compared to other schools around the country, as well as the efforts that UTK is making. They have a great plan in place, and you know they are doing a very good job with that. You know, there are things, of course, that she would like to see as a doctor. You know, things like you know, more testing, as Dr. Buchanan said, that one of her primary concerns was the decrease that we have seen in Tennessee statewide with testing over the past several weeks. You know, and she did talk about and talk about the bars and the alcohol sales and consumption and what other places are doing. Overall, again, though, really it was a very good meeting as far as comparing what the Southeastern Conference, the schools in the Southeastern Conference, and particularly the University of Tennessee, Knoxville, are doing with other schools around the country. And, you know, it's showing. So it was a very good meeting.
Dr. Bunn, did you want me to share my impressions of Dr. Burks?
Yeah.
Please, sorry. Trying to get to my unmute.
Okay. Yes, I was really grateful to have the opportunity to meet her. She was very impressive and very pragmatic in her approach, what works. And she said that, you know, in the southern part of the country, that, you know, we've been able to curtail and mitigate the virus in ways that science has learned how to handle things better. She did very much say that the more testing we can do, the better. And also she had very, you know, clear recommendations on, you know, gatherings and alcohol consumption and how those restrictions and those things have really helped. You know, we don't have to wait and find out what happens. We can see what's happened in other cities and other communities and other states that are very similar to Knoxville and Knox County. And so I thought her recommendations in those areas were very helpful, and we can try to get ahead of the curve and learn from our colleagues and peers around the country, so we can do the right thing. And yeah, I was really pleased to hear her encouragement.
If I could ask Chief Thomas a question, please.
Sure.
How have your enforcement efforts gone thus far, and what have you guys been able to do?
So mainly what we focused on thus far has been education, simply because we are still trying to find a good definition of a bar. So we focused on that. We've been out, especially on the weekends, seeing what we considered bars, if they were open, and we want to send that list to our beer board just to let them know what was going on. So it's mainly been in education. So if we can get clearer definition, clearer direction, that will help tremendously from the board. And that's what I hope to discuss tomorrow with my colleagues.
Thank you. Any other discussion on those presentations? If not, our agenda item is number 9 again, which is the face covering regulation 2020-1 up for review and discussion. And Dr. Buchanan, I may need to have you help me with this because my desk is inundated with all of these regulations. What is the expiration on the mask mandate? Is it coming up? Is it still?
There isn't one. The mask mandate is simply one we're going to review regularly. And, you know, I think one of the things that we might want to consider doing, and I realize now is not the time as our cases are going up and, you know, we're having increases, but to consider using our current benchmarks and maybe even looking at our positivity rate as a piece of that to consider when we would consider taking the mask mandate down within the context of the community and vaccine availability and all of those things. And we can certainly look at that. I think there are some benchmarks from the White House Task Force that might be useful in helping us trend that out. So if you would like, my staff and I can work on just bringing back a proposal for what we might consider looking at to consider when we would want to take the mask mandate down. We can do that.
I was curious if you had an opportunity to get in touch with either the health department or the mayor's office in Williamson County. I know they're not one of the big 6 counties that has their own independent board of health, and that the mayor would be the one who would have jurisdiction over the mask mandate. And that was removed, I want to say it was a week or 2 ago. Any information as to what their criteria were, or whether there was a criterion that was established?
I have not had any conversations with them, and with them not being a metro, getting access to what their data says is a challenge. I can certainly have somebody on my staff reach out to Williamson County and see what they used. I know what they used for schools was really not evidence-based and wasn't based in epidemiology. So I don't know what they used for their mask mandate removal, but we certainly can investigate that.
Well, it would, I think, be just a piece of the puzzle. It may be something we would not be interested in following at all if it's not based on some degree of evidence. But I'm just curious as to how they came up with that decision.
We can do that.
Sounds good. Any other questions or discussion about 2020-1? It's up for additional discussion right now.
So I guess my question to the board is would the board want a proposal for benchmarks to use to help guide in taking the mask mandate down?
Discussion on that?
Dr. Buchanan, how comfortable are you that the positivity rate is going to be accurate, or should it be more of a trend line? We have so much trouble determining what the numerator and the denominator is at this point. Just how comfortable are you with positivity rate itself as a criteria?
And I don't think we would choose one criteria, just like we don't have one benchmark. We look at all of our benchmarks, and it really is, I misspoke, Mayor, it really is the trend line of the positivity rate, not the positivity rate itself. You know, in combination with our other benchmarks, hospitalization, case rates, those kind of things. And then, you know, looking at the context of the community, you know, I think a vaccine might play a role in that. If our cases stay where they are, you know, and then when we start having vaccine availability, that might change what we want to do. You know, but we also have to look at, you know, if we're seeing 300 cases, well, I don't want to say 300, we're still seeing 200 cases a day, you know, and we drop down to 100, is that really adequate for us to say we want to take the mask mandate away? So I think we need to look at all those pieces, and I don't think there's one easy answer. We did get some suggestions from the state on looking at a combination of data plus adding, you know, that you would have less than X number of cases a day in addition to other positive indicators to be able to say, okay, we can safely take this away and not see a spike in cases. But even if we take the mask mandate away, the use of masks, the need for social distancing, the need to wash your hands and stay home when you're sick is all going to persist. It's going to still be there with or without the mandate. That's going to be part of our lives for a long time, because even when vaccines available, it won't be available to everybody right away, and it'll take a long time to get the population vaccinated. So, but I'm happy to pull that together and come back with a proposal if the board would like for consideration.
Dr. Buchanan, one person's thought, my thoughts on that is that I think if we have at least some guidelines that the citizens of Knox County would at least have something concrete to look at and a goal to strive for, to say, you know, if we get our positivity rate down, if the other benchmarks are hitting green, that, you know, we'll seriously look at removing that mandate.
Dr. Gocher, can I make a comment?
Yes.
So I mean, I'm in agreement with the direction of this discussion. I do think, for example, just testing volume, even though it's partially embedded in positivity rate, as already said, that if we're going to have more than one tracking testing volume, again, how do we keep rowing together to motivate getting testing done? That would be another important one. The other thing is that the, you know, depending on whatever sort of regulations end up existing, this conversation doesn't just apply to masks, for example. So I could see a situation where things get unwound in reverse order, and that there'd be different thresholds of this trend line. And I agree, it's a trend line. It's not an absolute, that you just go in the reverse order of whatever you did. And so I don't know that this is just specific about masks, because I think mask would be in all likelihood, the last thing unwound. But also to Dr. Buchanan's point, there still would be a lot of encouragement for people to wear those masks. The other thing I would just say is we're thinking through this, and I think it's a very valuable discussion. And I think that one that we need to have is that we all know, all the data I've shown is that there's always going to be these odd blips, these very brief 1 day, 2 day blips. And so on either direction, I don't think you want to, you know, just because you barely got below a threshold doesn't mean it's time to do something. You'd want to see 2 weeks, for example, of a trend before you said it was time to unwind whatever it was that you're at that level to be able to do so.
Right.
But
I think 2 weeks would be a minimum. I mean, when we're thinking about other outbreaks, we go 2 incubation periods before we let a nursing home start having admissions again when they've had an outbreak, or let people eat together. We go 2 incubation periods. Now, those incubation periods are usually shorter than 2 weeks. So I think we have to look at that too, take that into consideration. But yeah, I think basing it on incubation period is an important scientific approach.
But if this conversation can not only accomplish, if we can get there and think through it scientifically, and not only accomplish giving the public expectations about what to expect, and for that matter, if it gets worse, you know, what's the next thing that happens if it gets worse? You know, not only that, but if we can motivate along the way some of the right public health behaviors, that's the win, in my opinion, on this.
Other comments, discussions?
On a related to mask, but in a totally separate conversation, another thing Dr. Birx mentioned, and I really took this to heart, is she talked about how they were able to, using data that they have, kind of be able to tell when an outbreak occurred somewhere, when people had probably gone on vacation and things like that. And then she talked about how many people, even with a much smaller home football crowd, how many people are going to be coming to town from different places that may not be doing masks. And I do think it's going to be important that, assuming which I think we still will, that Knox County's expectations are clear to our out-of-town visitors about, you know, what it is the expectation when folks are in town. Otherwise, we're just going to have people come in, and potentially we'll see the effects of that 3 or 4 weeks later. And it may not even be in the stadium where that kind of stuff happens. So, Dr. Buchanan, do you have anything else to say about that?
No, but I agree. I think that one of the things that we might try to powwow with the university on, and maybe even the city and others, about how can we communicate to those who are coming and maybe won't even be in the stadium, our expectations and what our regulations are. And also, how do we facilitate enjoying and celebrating UT football the way everybody will want to, in a COVID-friendly way, you know? And so I don't know what that looks like, but I think it's something to think about. I think that was I'm not sure who said that, but talking about, how do we as a community enable people to do some of the things they want to do safely, and thinking outside the box is going to be important with that.
Dr. Buchanan, one other suggestion that I might have, and kind of open this to the board if there are any other comments, and that is, as part of this, as part of kind of a report to the community on a road forward, I think an introductory paragraph or paragraphs that describe the scientific basis that makes masks a viable therapy from a public health standpoint would be very welcome. There's, I know we all get a ton of emails, and some of these are very heartfelt, but some of the information is controversial, to say the least. And I think having that information out in front of the public with our best available information, our highest level of evidence, journals that have the highest impact factor, all that sort of stuff, to kind of show the logic that we're using to come to these conclusions.
Sure, and we can certainly work on doing that. Something that we do almost, well, not every day anymore, at our news briefings twice a week. We try to get that message out there. I think the audience might be dwindling for the media briefings, so maybe there's a different way to get that information out there.
Thank you. Any other discussions on 2020-1? If not, thanks to everyone for your input. Item number 10 is up next, is COVID-19 suppression of bars regulations 2020-4 up for review and discussion. Any comments, discussion?
I guess I'll just say one thing. It's going to we're going to move toward something else here when we talk in just a few minutes. And I think that's where the main discussion may come down. So this is something that I guess essentially is ready to sunset. So I don't know how much discussion we'll have tonight, but we will have some other discussion related here shortly.
So, Mr. Sanders, I don't know if this item on the agenda or another item on the agenda is the appropriate time to bring this up, but you all probably have received, or you may have received about 2 minutes before the meeting started, a letter from an attorney representing several restaurants in the area wanting to talk about tabling some of the measures that we're talking about. Is it time to talk about that, or do we wait until we get into either item 11 or 12 or 13?
I don't really care. It's up to you. But since you've already brought it up, let me just discuss it with you briefly. Obviously, I'm going to keep legal advice on litigation issues to a minimum during a public meeting. But overall, I've read the letter. It's a sort of shot across the bow kind of letter. But I'm not worried about its content. Lawyers write lots of things for lots of reasons, but as far as is the board going to be doing anything illegal by proceeding with the agenda item, my answer is no, it is not. So feel free to proceed with the agenda item if you wish to. If you wish to table it as the letter asks you, then obviously that's up to you, but don't be concerned for the legal issues. If they want to bring suit, they can bring suit.
Thank you. And we can probably go into that in more detail as it applies to any of the items that are down in the agenda today. So 2020-4, any other discussions, comments, questions? I sense there are none on this because of the sunset today.
This is Maria Hurt. So I need to get clear what we're doing here. if we know that on the agenda is another regulation that may impact whether or not this regulation stays in place, I just want to be clear what we're doing here. I don't want this to sunset if we're not sure as a whole what we're doing to either replace it or not replace it. So I guess I need some clarity there. What we're going to achieve right now.
Dr.
I think I can help you with that, but we may ask Mr. Sanders. It's the way it is engineered to sunset. I believe it would be tomorrow, which means it's active right now, and we are reviewing and discussing it. But in the absence of a motion to do anything, that's all we're doing right now. As we go through future items, which are draft regulations and other regulations, I think 2020-4 could be reviewed and discussed and voted on if there's a change or sustaining it. I think anything as we go down through discussions of items 11, 12, and 13 would be in order. So I don't think that kind of closing discussion on this closes the discussion on the item itself. Mr. Sanders, is that substantially correct?
I think that's fine. Technically, there's another way you could do it, which would be to move, if someone wanted to move to extend 2020-4, you could move it, get a second, and then table it pending the further discussion. And then depending on the outcome of further discussion of other issues, you could take it up again and then vote on your original motion. That would probably be the more correct parliamentary method, but as long as you're all in concurrence with what you propose, that's essentially an informal amendment to the agenda.
Discussion.
Okay, that makes sense to me. Thank you.
Okay.
I agree. That makes sense.
Okay.
Reasonable.
Great. So next item on the agenda then, if there's nothing else on that one. Yes.
So, Dr. Gocher, just as a point, so does that mean we needed a motion and second and table to be able to do that, Mr. Sanders, or did I misunderstand what you said before we move on?
I said that's one way to do it, and probably technically the parliamentary correct way to do it. However, what Dr. Gocher suggested of simply discussing the other issues in order and taking up a motion on 2020-4, which I suppose could technically fall under new business also,
okay,
is not improper as long as everybody's in concurrence with it. This is your meeting.
Okay, understood. I apologize. Dr. Gocher, you're on mute.
Too many times. It's certainly appropriate if somebody wants to make that motion and second it to postpone definitely or table till later in the meeting. That's okay, or I think I sense we can just discuss it at that time. It's up to you guys, whatever you'd like to do. We're okay to proceed?
Proceed.
All right, great. So next on the agenda is number 11, restriction of all alcohol sales and consumption after 10 p.m. For review and discussion.
I'll go ahead and start off. After what's been going on, we know that the community of downtown and around the university has been of some concern. I, as one member of this board, do have the concern that, as Dr. Birx has talked about, that we need to look at alcohol consumption. I took a field trip on Saturday night across the city late and was able to see how a number of areas around businesses were operating. And I was not happy, to put it mildly, with what I saw. Knox News had a photographer out at the exact same time that documented what I saw. And I saw very large crowds in the strip area. I did not see, thankfully, large crowds in other areas such as Gay Street or the Old City, but I saw bars blatantly open, telling patrons they were going to stay open until 2 a.m. And really concerned me. I saw large numbers of students pouring down the hill toward Lake Avenue and the Strip. And because of that, I think it's time for us to look at some of the things that Dr. Birx did talk about. And therefore, that's why we have 2 draft regulations for us to consider, one of which concerns basically, if you look at it simply, closing of those places that sell alcohol, restaurants, bars, and places that allow brown bagging at 10 p.m. This would not affect restaurants that do not serve alcohol, that don't have liquor licenses. It affects these. It is proposed for a 4-week period. And then the other is on limiting gatherings based on social distancing within small areas to include not only inside, but immediately adjacent outside on the private property of the business. These are not proposed for homes, for private property in that way, not for churches, not for schools. So I just want to bring that up as we go forward. Thank you.
So, question to either Dr. O'Brien or question to the board. In crafting the proposed regulation, are we looking at restaurants as strictly closing their alcohol sales and remaining open for food service, or closing down completely at 10 o'clock?
The way this is written is that they would close at 10 o'clock because of congregating, and it would be for a 4-week period.
But just a quick point of order, we'll need a motion and a second to begin discussion.
Yep. So we've had some general discussion. Is there I don't see on the agenda that we have a numbered resolution. Is there a numbered resolution to talk about?
We do. It's 2020-5.
2020-5. So we have potential to begin more formal discussion, but we'll need a motion and a second on 2020-5 to begin.
I'll make a motion to adopt draft regulation 2020-5.
Is there a second?
I'll second.
So we have a motion and a second, so discussion on 2020-5, please.
Dr. Goetzer, if I could start, please.
Sure.
So thank you. Last week, we were very close to rescinding the curfew on bars altogether. Now this week, we're looking at even stricter regulations. And if we think about what changed, as Dr. O'Brien mentioned, the News Sentinel ran an article with a picture of the activities on the Strip. I talked with the owner of the Uptown Bar and Grill today, which is the restaurant that picture was taken in front of. Of course, the News Sentinel did not go inside and talk to him. They did not go inside the restaurant. They took the picture outside. Their capacity is 500 people. They limit that to 200 now. People have to wear masks. They have to sit down. If they're not wearing masks, they are told they have to wear a mask. If they don't want to, they're asked to leave. This gentleman's name is Nathan Queen. His mortgage is $8,000 a month. He has 44 students that work there part-time. Now you might be saying, well, you know, if it's the curfew, you're not closing altogether, how much does that impact him? But with all the things that have gone on thus far, and we're looking at the economic impact that COVID has had, as well as the restrictions that we have placed on businesses, all of these restaurants and bars are running at very thin margins. Mr. McQueen has lost a tremendous amount of money this year, and that hour or so that he has left is money that he and his employees need to survive on. This time, there's not going to be any federal government program that's going to step in and pay for people. It's with the PPP that we saw last time. There's not going to be any of that. They're going to be on their own. Whatever is done to harm those businesses is going to be absorbed by the owners and by the workers. Everybody on this board, including myself, has a job that we will go to tomorrow. Some of them may not. because of the actions that have already been taken and any actions that may be taken in the future. When Dr. Birch was talking about alcohol sales and the consumption of alcohol, it's somewhat conjecture. And we all realize that because when we do our own, when Dr. Buchanan does their contact tracing, it doesn't come back to bars, okay? It comes back generally to family gatherings. That's what Dr. Birch said as well. Family gatherings are a huge issue, but it doesn't come back to clusters at bars. Now we can say, well, people don't know who they're standing next to at a bar, sitting next to at a bar. A lot of the bars in our community, a lot of the restaurants, you see the same people there all the time. I talk to people that frequent those establishments, and they kind of have the same crowd. So it'd be the same as if they were at other establishments. They know who the people that they are sitting next to in many cases. I worry very much about the enforcement on this. Across the country, we have seen that confrontations between the police and the general public, at this point in time, we don't need to do that unnecessarily. Okay, and I appreciate Chief Thomas. I appreciate everybody in law enforcement for all that they do, and they do a lot. We don't need to burden them with unnecessary confrontation, which could lead to some real problems. And then lastly, it's interesting, as of yesterday afternoon, Governor Beshear in Kentucky actually lifted their curfew or extended it to 11 p.m. on bars. Governor Beshear has been much more restrictive than we have been here in Tennessee. I don't think it was a scientific decision. I think it was a political decision. I think it was an economic decision. It was to allow people to go to the bars after a game. Same thing happened over in Nashville when Mayor Cooper has allowed people to stay another half an hour after football games. So how much of this are we basing on science? How much are we basing on we need to do something? Because if we're basing this on we need to do something, if we're basing it on people have to comply, that is not good public policy.
I'd like to say something. One, thank you, Mayor Jacobs, for sharing your perspective. I'd like to say something and I'd like to ask something. We're all painfully aware that any restrictions on any business is going to impact people we know, our fellow citizens. So we don't take anything lightly, but in terms of making the decisions that we do, they are based on science. We know that, we just know this, that alcohol consumption inhibits people's ability or interest to observe the 5 core actions. I saw those pictures in the Knox News too. It was more than one just facility. And in terms of unfairly burdening our law enforcement with enforcement, I would actually like to ask Mayor Kincannon and Chief of Police their perspective about the issues that you're bringing up. I am a little concerned to automatically link enforcing these regulations with riots, which I felt like that's kind of what you were implying. Perhaps I'm mistaken, but I'd like to hear actually from Mayor Kincannon too about her perspective of the impact that trying to mitigate the opportunity for this virus to spread, and also the economic impact, especially in this area, of course, close to campus.
Thank you, Dr. Hurt. I wanted to, can you all hear me okay?
Yes.
I had the opportunity to speak to the president of the Cumberland Avenue Merchants Association today. They're a great group of merchants who are very community minded and very active in our economy. And the president of this association recognizes the conundrum they're in. And our conversation, our conclusion, and his conclusion, that message that he wanted me to convey is that they depend heavily on UT being open for all their business. And UT patronizes UT students, faculty, and staff, keep the restaurants going, keep the stores going, help all of the businesses on on Cumberland Avenue stay in business, and those are the economic things. So their take was that it's better to have some restrictions and be able to stay open, even if you know, for the sake of public health, because the alternative is not that we just go back to 2019. The alternative is that a lot of people get sick. There have been students hospitalized, is what I've heard, and that science has shown, and you all know because you're public health specialists, you're medical professionals, that alcohol inhibits people's ability to exercise good judgment. And good judgment is what we need people to be exercising to follow those 5 core actions. So, so I think listening to the merchants as a whole is really important, and it's in the economic best interest and the public health best interest of the city to mitigate the coronavirus. Right now, the uptick in cases seems to be primarily among those 19, 20-year-olds, college students and whatnot. But as they interact in the community, and Dr. Birx mentioned this several times, they're shopping in Knoxville, they're going out and about and you know, in our community, living their lives, and that's good. We love having University of Tennessee in Knoxville. It's why many of us are here and part of this community. And we love the Vols and we love rooting for our sports teams. But we also need to know that as students get it, they may not be affected so much, but the people of Knoxville may be more at risk. There's more people, we're older than college students. We sometimes have more poor health conditions and lack of access to healthcare. So that's the concern I raised to Dr. Birx, and that's when she said we need to treat student activity, you know, student infection rates as the same as any other Knoxvillian. So that's why I'm really grateful you all are considering Dr. O'Brien's motion. I think now is the time to take further action to mitigate, you know, suffering and help make sure that we don't have more economic hardship because people are getting sick. We don't want UT to have to close. We don't want Knox County schools to have to close. So that's that. And as far as law enforcement, Chief Thomas, I'd be happy. She's here. That's her job. She's a professional in law enforcement. I know she's ready, and her team of the other law enforcement partners in the community and codes inspectors and our fire department, the city of Knoxville and all our team are ready. And I know the health department, we've been partnering with them all along on these enforcement strategies. So I'll let Chief Thomas speak to those law enforcement issues more directly.
So I think Mayor Kincannon hit the nail on the head. We aren't in charge of passing laws or what we enforce. We enforce those things that you all ask us to enforce, and we will do that. That's our job. We'll do that professionally. We educate people as best we can. We try to do it as compassionately as we can, but it's our job to enforce the laws and orders that are passed by the bodies that do that. And that's what we will do. On a personal note, I will tell you, I have concerns both ways. I just saw a news blurb about a couple of UT students who've been hospitalized. On the other hand, I have my older son manages a small pizza store. So I worry about his job. He's in an apartment, he has a lease. So I can have concerns on both sides. But you will do what is best, is what I have faith in, and I will enforce whatever you decide.
Thank you. Other comments, discussion?
Following up on that, if you don't mind, Dr. Gregg, how many students from UT have been hospitalized that you know of? You're muted, sir.
We're at this time, we're only aware of 2 that have been admitted to the hospital. But again, we don't have access to that information unless a student chooses to make us aware. Same for our faculty and staff as well.
Sure. And I guess my question for the rest of the board would be, it's an 8 priority statement that we know, and we do, that alcohol causes lapses in judgment and causes people to exercise bad judgment. But statistically, where is the evidence that when we look across the board, that this action in other places has helped? Because I keep hearing, we know that, we know that, we know that. I have not seen any data.
So just real quickly, there was a study that came out of the CDC on Friday in their MMWR that they actually looked at close contacts of adults that had been diagnosed with COVID, and they found that people that were actually positive were twice as likely to have either dined inside a dining establishment or gone somewhere to drink inside an establishment, as opposed to those that were negative. I've only looked at the abstract. It just came out a few days ago. But there is some evidence that's actually starting to support that when you're in these closed environments, whether it's dining or dining and drinking, that does put you at higher risk, especially if you're in an indoor setting. So there's starting to be data. In terms of other cities, I know that certainly Nashville did this, and I don't know the numbers there. Maybe that's someone else can weigh in on that, but I'm happy to share this with the rest of the board as soon as I stop talking.
And I think when we've looked at Dr. Shamia's data, comparing us to the other large metros, I know one of the differences between us and the other large metros is that they do have restrictive regulations in place in addition to mask mandates. So that is one of the differences between where they are, where we are.
And I would just say that I don't want us to lose sight of, I mean, you know, we're managing this at a local level. There are other states where this type of thing has been managed at a state level. I have family in Ohio, and their governor, I mean, they've had, I believe theirs is more on the timing of the end of sale, but across the board, not just a bar type establishment at a certain time at 10 o'clock. So, I mean, there's precedent, and Mayor Jacobs, back to the data piece. I mean, we're, as they say, we're, you know, that the data will gradually become, I mean, we're living through this right now. This is not the way that we would ideally like this to be, but the data, you know, at some point in time will become more and more available.
Just one thing to say in the whereas of this proposed regulation, the MWR information is there, as that is a way to look at this, that their CDC is finding this is more of a problem, and we want to head things off, and we want to do it for a defined period of time. This proposal is for 28 days. So that would mean if it works and our numbers go down, by the second home game, we could potentially have this over with. So we need to, it's one of those things of taking our medicine now or taking it later, I feel, as we are living through this. It's tough to know, but that's our way forward, I think.
Is there any appetite above the board to move the curfew back to 11 or to midnight?
So if there's no other discussion, I have a point I'd like to make. And what I'm proposing is not a resolution, it's not an amendment, but a question. So I think if everyone kind of agrees common sense wise that what we saw in the newspapers and what Dr. O'Brien experienced firsthand by looking was, number one, outrageous, number two, very dangerous. My question would be, in the simplest way possible and in the least obtrusive for good business owners, how do we solve that problem? How do we solve what we saw? Because that's the problem. Thoughts?
I would like to again direct us, as I did several weeks ago, to the White House Task Force recommendation. I guess that was in, I want to say, the first week of July, when Tennessee was in the yellow zone, and we began considering the effect of keeping establishments, basically sales of alcohol, available, that the impact that might have, also as we were anticipating the schools eventually opening. And so there's a new White House Task Force report that Dr. Birx provided to the city and to us. And perhaps Mayor Kincannon, you can highlight some of the things that Birx shared with us, because we're no longer in the yellow zone, folks. We're in the red zone. And that has serious ramifications. I mean, the head of the White House Task Force just doesn't stop by randomly in a city in the US for tea and crumpets. This has got the attention of people who look at the big picture nationally to keep all citizens safe and to keep our healthcare system open and running and being able to function and offer services to all of our fellow citizens, not just people who have COVID. So, so I'd like Mayor Concanon, if you can, just to kind of review the highlights in Dr. Burke's report about Tennessee specifically and in Knoxville, if you will. Thank you.
You all actually all have a copy of the latest White House report, which is more recent than the one Dr. Burks provided. It's from 9/13. We sent that out to you earlier today, I believe.
Thanks, Dr. Buchanan, and your team was kind enough to share that report with me as well. I'll just note, as you guys I know get a lot of emails and may not have had a chance to look at it real closely, but on page 3 of the document you received today, it says Knox County is in the red zone, not the yellow, the red. So I mean, this is coming from the White House and coming from the state of Tennessee. This is not conjecture. This is not people calling the sky is falling. This is based on the data that we've experienced here in Tennessee. And Dr. Buchanan and Dr. Shamia and Mayor Jacobs and I were all at this meeting with Dr. Burks, and she did speak really explicitly about the role of alcohol consumption and that other cities were able to reduce their infection rates, to get their transmission, the RH factor, the rho, whatever, you all are the medical professionals, to get it, ours is above 1. And 1 doesn't sound like much, but above 1 means it's spreading rapidly throughout the community. And she said that in other communities, they closed the bars. But I think that she also said that restricting the consumption and sales of alcohol after 10 p.m. worked pretty well too. And that's why I think Dr. O'Brien's motion and proposed regulation is a good balance between the need to stop this virus, to start containing it and prevent more people from getting it, particularly our more vulnerable populations, and also recognize that we need to be able to live with this pandemic and keep our economy running and keep UT open at the same time. So this isn't a closure; it's a balance, and we're learning more. And I think this is a reasonable approach.
Mr. Sanders, as a guest on this board, Dr. Hurd asked a specific question of Mayor Concanon. Should she be opining on her opinion on this regulation?
I believe that it's up to the board, really, Mr. Mayor. You all invited her through the chair, and the rules you establish are your rules. There's nothing hard and fast that I can say one way or the other about the extent to which the board asks a guest, you have a number of them, of course, to curtail their comments. It's fine. Really up to the board. I can't really give you much more definition than that.
I would say back to Mayor Jacobs' question about entertaining the possibility of 11 p.m. versus 10 p.m. One of the things that Dr. Burks did say, which is why I had somebody go get my notes because I couldn't remember exactly, that restricting consumption or consumption after 10 or 11 p.m. Had impact. And so just as people consider that I don't know if you're putting that forward, Mayor Jacobs, as a friendly amendment to this resolution. And so I'm just making note of that.
Dr. Gocher, I had a follow-up question for law enforcement. Just as far as I know the specifics we may not need to know as a public health board, but just in general, what does enforcement, what do you think it looks like? I mean, I do want to be attentive to that. And so what would be the overarching strategy for that?
And I guess I probably take that direction from you. I mean, whether it's, citations, arrests, is it, it's whatever you all decide, enforcement, whatever that needs to be, then we'll get together and find out, can we enforce that? For example, the current order, we can't define what a bar is. So it was hard for us to enforce. So we did other creative things. We tried to educate. We tried to take down names to give to the beer board, things that we could do within the means we had. So if we have concrete, a certain time, and we don't have to come up with a definition of what a bar is, we can write a citation. But we can also, we can educate. I would like to, my goal would be to meet with my colleagues tomorrow and then put out some kind of a PSA or a letter to all of our establishments that this is what's going to happen starting this weekend. So everybody's aware. I don't know that everybody watches your meeting, but we need to get that information out. It's a shame, but we need to get that information out, I think, and then we need to follow up with enforcement and do what we say we're going to do. That's what's been hard, is for us to go in establishments and not be able to do what we want to be able to do, or something concrete to stand on. Does that answer your question, or is that?
Very much so. Thank you.
And Chief, I'll just and you and I can talk offline, but if you put something together, we certainly can help get that out, since we do regulate many of these establishments.
Great, thank you.
So I have a question for Mayor Jacobs, I think in particular, and because I'm just not aware of the details here. How late do restaurants typically stay open on the Strip, or anywhere in town? Do most restaurants close at 10 or 11 or 12? Or I know that when I finished a late case at UT Hospital, I was able to go over in the Strip at 4 a.m. and get a sandwich. So some of those places are open all night. But what's the general time that they close? And is it that an 11 o'clock overall closure of both bars and restaurants would work? What's your thoughts?
Many close at 10, but on weekends, a lot of them close at 11. And my major concern here is that you're capturing those establishments, not just the bars, which are targeting, but the rest of the restaurants that might serve beer, wine, alcohol, whatever, throughout the entire county, not just on the Strip. So that's my major concern. And also, Dr. Burks came here as part of a tour of all the Southeast Conference schools. So it wasn't specifically coming to the University of Tennessee, singling us out. She's been to Oxford, she's been to Lexington, she's been all over the place. So that was what that meeting was about. But per your question, an 11 o'clock closure would help many of the restaurants, because then you wouldn't be closing, they wouldn't be collateral damage, for lack of a better term, in this regulation.
I think that one of the problems that we may have had in defining restaurant versus bar is that it's difficult on an enforcement end and difficult on a regulatory end to know whether somebody's records are going to indicate whether they're 49% food or 55% food or whatever. And I think at the time they go, if somebody serves a citation against them, they'll say, you can't stop me because I'm a restaurant. 55% of my income is from food. It's really difficult to figure that out. I mean, operationally, that's a pretty good definition, but from a practical standpoint, it's difficult at the point of enforcement, and it would really leave any enforcement difficult to do, I would think. Thoughts about that? Comments from everybody?
I have a question. If it's the sale of all alcohol, does that include convenience stores and like the pilot station on Cumberland Avenue, or from selling alcohol?
I think perhaps I can answer that question for you, Dr. Gregg. The regulation which is in front of you concerns it's entities that sell alcohol for on-premises consumption. So unless Pilot's allowing people to pop up in a cold one while they're standing in there, the answer is no.
And I think the risk comes with the gathering inside and socializing and consuming alcohol. That's where the risk for COVID occurs. And so having this limitation has proven effective in other communities in reducing COVID cases. So that we're kind of basing it on that. So specifically in restaurants and bars where you go there to eat and drink.
One thing I'd like to say, based on what I saw last weekend, that made me change from an education only thought to a enforcement line of thought. I think we're at that point. I don't see that people should be arrested, but a few citations of either a business or of individuals may be in order to make sure that we can change this. I want this to be as brief as possible. And so that's why this is being proposed with a time limit on it. And both of these proposals that are be coming up are one way for us to kind of deal with this upswing now instead of later when numbers could get a lot worse. And just speaking personally, I've had somebody I know pass away from COVID locally in the last week. So it is out there. It does affect people. And we do need to be watchful and we need to be proactive.
Yeah, I would like to tag on to that. Thank you, Dr. O'Brien, by pointing out that we're talking here about doing something that we all believe is necessary based on the data, based on looking at what's happening in other cities and states, and not just doing something to be doing something. But when we first convened third week of June, we had, I believe it was about 6 positive cases. As of a couple of days ago, yesterday, it was 219 cases. We had 14 hospitalizations when we first met. And our intention when we first met was, yes, let's see what we can do to encourage people to do the right thing. Let's pass a regulation that's really focused on education, not punitive. But clearly it's not working because now we have, over 100 people in the hospital. When we first initiated the mask mandate, we had 9 people on ventilators, which are breathing machines for those of you who aren't in the medical field and happen to be listening. People cannot live unless they're on this breathing machine, and they're very expensive machines. We don't have gobs of extra ones, but we had 9 when we began, and we have about 24 people in hospital on vents right now. So clearly our intention, of course, would be educational, supportive, encouraging people to do the right thing, but that hasn't worked enough. And so that's why we're having this discussion, not just to be doing something just because, but because the data in front of us locally indicates, as well as the advice we're getting on a national level, indicates that we need to do something to preserve our healthcare system, the people who work in the system, as well as keep people out of the hospital and healthy.
Additional discussion? Mr. Sanders, this might be an appropriate time to not necessarily address, but maybe discuss the letter that we all received just a few minutes before. I've been sort of glancing at my phone and looking at it, and there were questions about the law, the regulation being proposed at 10 o'clock, and I think that's open right now, whether we go 10 or 11, maybe not. But the letter requested it based on some legal background that maybe you could help us with, that we, and that the word used was table, but as we've discussed before, you don't postpone something definitely from one meeting to the next. It would be at the end of this meeting, but it would be some method to delay a final action for 1 week to give the stakeholders an adequate time to either appear before the public or send additional information, et cetera. That's my take on that letter. And I'd sure appreciate your take on it and maybe guidance for us on that regard.
Well, I thought I had already given it, to be honest. The letter, and first of all, I should caution you all, as an attorney, I really am not comfortable discussing legal strategy or legal issues in a public meeting. If the board asks me to, I will, because the attorney-client privilege belongs to you, not me. But having said that, I would prefer to keep most of my strategies to myself. Overall, what the letter does is says that it feels you're violating the letter and spirit of the Open Meetings Act. I can tell you, I don't agree with that. I think you noticed the meeting properly and you noticed what was on the agenda properly. If someone wants to challenge your meeting or the outcome of the meeting based upon an alleged violation of the Open Meetings Act, they know where the courthouse is. We'll see them there. Otherwise, they're essentially attacking the substance of the bases for the potential findings of this group. That is, they're attacking the science behind that. This board is not obligated to a standard of perfect science. This board is obligated to have a good reason for coming up with whatever it comes up with. It is not obligated to have a perfect reason or to be perfect in its scientific conclusions and findings. So I think any action the board takes is legally defensible. I will tell you if I think you're about to take an action that I don't think is legally defensible. Whether you choose to give the restaurateurs the opportunity to come before you is entirely your decision. That's immaterial to me. So I tell you that I will defend in court an action that you take. And I am not overly concerned with what I've seen in that letter, although I acknowledge that the entities coming, that those entities can amass a great deal of money for legal fees and they will have a top flight attorney. Does that answer enough of your questions?
I believe so. So as we continue these discussions, we have, I think, at least informally brought up an idea of 11 p.m. versus 10 p.m. I don't know whether there was any motion that has been made or an amendment that's been made. And maybe Dr. Brian O'Brien, that you could discuss whether or not that you would agree with an 11 p.m. or as opposed to a 10 p.m. Time limit, given the fact that Dr. Birx had said either 10 or 11 would probably work.
At this point, I would like to see if there's any further discussion from members. One way or the other, my personal preference is to keep it at 10 because I want to try to mitigate this as quickly as possible and get back to normal as quickly as possible. So fewer interactions and contacts, I believe, will lead to that.
Questions, comments?
Is what we need to stick with.
Dr. Drake, I couldn't hear you very well.
Yeah, I didn't hear that.
Muted.
Now you're muted.
Yep.
All right. I agree with Dr. O'Brien that we should stay with 10 o'clock because even the county mayor said that a lot of restaurants close at 10 o'clock. So it's my experience in a restaurant that most people are through eating before 10.
Further discussion, Mayor Jacobs.
Just to clarify, many do close at 10. On weekends, many close at 11. So sorry if I misunderstood or misspoke.
Other discussion?
What I have to say has nothing to do with the time cutoff. So if there are any other comments on 10 versus 11 p.m., we should have those first. And then I have a couple of just clarifying comments.
So I do have one comment about 10 versus 11. You know, what Dr. Buchanan mentioned about Dr. Birx, I heard that too. She said 10 or 11. I think more it's what we're in this strained situation. I mean, there's tension. And so Mayor Jacobs, as a physician, as a scientist, I agree with Dr. O'Brien as far as the 10 o'clock from a public health standpoint. If this is going to accomplish what it's intended to, makes more sense. I guess my question to you is simply, do you feel that I'll call it a compromise to 11 o'clock for the reasons that you've mentioned? And, it could be, I suppose that the time could even be, could even change depending on the day of the week. But let's say it's just 11 across the board. Is that viewed as a compromise, or is that as toxic as the 10 o'clock? Because ultimately there's going to be this continued tension between public health and these types of issues. I mean, we can't escape that. That's just where we are right now. And so, with the hope of, and then there, we all want absolutes. We want science to tell us precisely what it's going to be, and we're not going to have that. And so I would just ask you, I know this is not in the big picture what you want, but does that help at all?
And you're exactly right, Dr. Schmidt. There's always going to be that tension. So I can't say that it's going to be less toxic, but from an economic standpoint, a financial standpoint, for restaurants that are restaurants, and we all know them as restaurants, but they might have a bar in them, and they might serve beer or wine, and they might have mixed drinks at the bar. For those that close at 11, this would probably help them tremendously. So and again, I'm not just looking at the Strip. This is the entirety of the county. We have those all throughout the county, and we have to consider that too. And I know that's when we're looking from public health perspective, and even a legal perspective, makes it difficult because we're trying to focus on one particular geographical part of the county. But we have to realize too that this would impact all these other restaurants as well. So is everybody going to be happy? No. Are they going to be happy with 11 o'clock and 10 o'clock? Yes, sir. And you're exactly right, though. I mean, I understand, and I think we all do. This is not a great situation for anyone. None of us want to be in it, and we are. So we're all doing the best we can.
Further discussion? If there is none, I would like to offer an amendment to either be a friendly amendment per Dr. O'Brien, or an amendment that we vote on to change that time limit from 10 to 11.
At this point, I think I'm not going to accept that based again on the science. I know that's 28 more hours that could be available to businesses over the course of the term of this. But I think I would rather see what we might do as is at this point.
So in the absence of a friendly amendment, is there a second for discussion? If not, any second to that?
I'll second for discussion.
Okay, so the motion's been made and seconded. Further discussion?
So just for clarity, the your amendment to change the closing time from 10 p.m. to 11 p.m.
Yes, Dr. Brown. Strictly that. Everything else would remain the same.
And just so I'm clear, this is for all establishments on-site consumption of alcohol.
This would be for all establishments, and as I understand Dr. O'Brien's resolution, it would be for restaurants in general. Is that correct, Dr. O'Brien? Or if a restaurant does not serve alcohol at all, do they have to close at 11?
They do not. It's for restaurants, bars, and other establishments that allow brown bagging will close at 10 by what we proposed, or 11 by what you might change it to. Okay. Otherwise, if you're going to a restaurant that stays open that does not serve alcohol, they can be open all night.
Or is it possible that if the restaurant ceases serving alcohol at either 10 or 11, that their hours could be extended? They could close at midnight.
That's really complicated. It's really
Oh, I mean, I'm not putting that as an amendment. That's a question to the author, to Dr. O'Brien.
I agree with Dr. Buchanan. I think that would be difficult. I think having something that is even across the board so that if we have law enforcement involved, they know if they're out there at 10 o'clock or at 11 o'clock and it's after that time, everybody follows this. They are closed. So whatever their closing mechanism is, they may close the door, let somebody finish eating their meal, and then let them out, but nobody else gets served, nobody else comes in. It's cut and dried that way.
If I can leap in here, apologize. The wording, if Dr. O'Brien wishes the wording to effectuate what he just stated, he needs to amend the wording somewhat. Right now, the way the wording of paragraph 4 of this resolution reads, the entities would have to stop serving food or drink, alcoholic or non-alcoholic beverages for on-premises consumption, or in the case of those businesses that we're calling brown bag establishments, stop permitting the on-premises consumption, but it says nothing about those entities closing. That is, they could stay open all night long under this regulation. They just can't serve anything to eat or drink. And I just want to make that clear because that may be a distinction you all are interested in.
Mr. Sanders, to make things clear, should we change the word at 10 p.m. to close? Can we do that simply?
Most likely, I'd need to read it here. Yeah, I would say in about the third line down, in Knox County shall, then scratch out, suspend offering food or drink, including both alcoholic and non-alcoholic beverages for on-premises consumption or preventing the on-premises consumption thereof of the same, and then substitute in there close at 10 p.m. daily. That would effectuate what you are trying to do, but that would also take an amendment to the proposed regulation at this point with a second. Of course, you as proposer could consider that a friendly amendment if you wanted to, but it substantially changes the regulation. I feel more comfortable with a formal motion and a second for that and a vote on that, because that's not a minor alteration. That really effectively changes this regulation.
Don't we need to finish our discussion about 11 versus 10?
You do.
Do that.
So we have a motion and a second for that. Is there any other discussion on 10 versus 11?
I would like to flesh out the idea a little more of why 10. If we're talking about closing businesses, why not 11? Why not just extend it an extra hour? I mean, I totally agree. I've been proposing for several weeks, if we just make it equitable across the board, all alcohol, whatever type of establishment, all alcohol ceases, it makes law enforcement, enforcing it makes much easier. And we've heard from other businesses, bars, that say that would be more equitable in their perspective. But I want to be clear in my own mind, the advantage of 10 versus 11 p.m. I understand that's part of the original proposal, but I'd like to be clearer about what the distinct advantage is of 10 versus 11 p.m.
I don't know that we can say for sure what the distinct advantage is, other than we set a time and we try to have less interaction with alcohol and gathering. Again, for the time period we're talking about, it's 28 hours. If this group feels that we should move to 11, that can be done. I was looking at it more scientifically, and just less interaction leads to less issue with passing on the disease. That is all. And I'm hoping again, I don't know for the police department, if it would be an issue saying this is the word closing versus they stop serving, if that would make it worse or better having one or the other. So could I ask Chief Thomas just to pipe in?
Again, at point of order, I think we need to finish our discussion and vote on 11 versus 10. I'm sorry to keep doing that, but
So
we need to do that.
thank you, Dr. Buchanan. Any other discussion on 10 versus 11? I kind of putting it.
I'll just say fundamentally, this gets back to the compliance and enforcement piece. I mean, if 11 means close at 11 versus if 10 means that, you know, maybe not closed, and if the police go by and do a citation, then close, then, so I guess I'm just, having not seen the level of compliance and the effectiveness of the enforcement, that's kind of what those 28 hours, if it's just 28, and again, this is not, you know, there's only so much precision we can have here. But knowing that that still may be a little bit of a moving target, the more conservative may be better from a public health perspective. But the citation piece or whatever that is, I mean, you know, hopefully that piece will be effective ultimately for those that stay open.
So I guess just a comment speaking to science on this, the science is just not that well hewn. It, from, you know, makes sense from a common sense standpoint. I mean, if you closed at 9 or you closed at 8, you would probably have less transmission of disease, but the economic impact would more than quadruple, I would imagine. I mean, I think you could put a finger on the economic impact pretty precisely, even between 10 and 11. So I would continue to speak in favor of 11 versus 10. Questions, comments? Hearing none, are we ready to vote on the amendment to extend those hours to 11 p.m.? Narda, if you're available, we can have a voice vote if there's no other comments on that.
This is just the amendment that we're voting on, correct?
Correct, Dr. Hurt, that's correct.
Yes, sir. Dr. Drake,
No.
Dr. Gotcher,
Yes.
Dr. Hurt,
Yes.
Mayor Jacobs,
Yes.
Dr. O'Brien,
No.
Dr. Shamia,
Yes.
Dr. Sousa,
Yes.
Ms. Wagner,
No.
Dr. Buchanan,
Yes.
So in order, our totals are,
6 and 3.
so the amendment passes, as I'm assuming, amendment passes. So we're looking now at the amended resolution at 11 o'clock, and discussions open on the amended resolution 2020-5. Comments? I know we've discussed this in general. Comments specifically about this regulation at this point.
Could I ask the chief to comment on whether something that says closing is better than saying all sales cease, just from her perspective?
Yes, sir. Thank you. I would agree that closing is much easier to enforce. It's much easier seen than just stopping selling and still remaining open. So we can definitely determine it's a very firm footing for us to stand on. So yes, sir.
Thank you, Chief Thomas. Other discussion, questions, comments, and we are discussing 2020-5.
I'd like to then propose a friendly amendment that we change the wording as stated to closing instead of, and take the other wording that Mr. Sanders was noting of ceasing sales of alcohol and food out, to make it clear.
So if we have that as a friendly amendment, Dr. O'Brien, I just need the agreement with your seconder.
That would be Dr. Souza.
Thank you for the reminder. Yes, that's fine with me.
Okay. So with that amendment, changing that word to closure, the discussion is ongoing on 2020-5. Questions, comments, discussion? Floor is open.
Just a general question. So the intent of the enforcement, which we've already discussed, which was it mentioned a citation, certainly not an arrest. That is not part of the formal resolution. That's intent, and that's direction that they've asked for. So that really doesn't. That's separate from the formal process of the vote. Do I understand that correctly, Dr. Gocher?
I believe you're right. Mr. Sanders, clarify that.
Sure.
Would.
This board doesn't have enforcement power. This board doesn't have the authority to arrest or cite anyone. So all you can do is pass a regulation. The sense in which there's a citation involved or any other law enforcement action is that it is a violation of the Tennessee Code to intentionally violate a Board of Health regulation under these circumstances. So if law enforcement chooses to enforce the regulation, they can, but that's out of this board's hands.
Very good. Thank you, sir.
So discussion is still ongoing now on 2020-5 as amended.
Mr. Sanders, what are the penalties for violating this? And I know, that Chief Thomas, of course, they will do their best, in that regard, but what are the potential penalties?
Recognizing that I don't practice criminal law, it's a Class C misdemeanor, which I believe is up to 30 days in jail, a fine of $50, and I think that's about it. I don't. It's the lowest level of misdemeanor on the law books, but I think it's 30 days or $50 fine.
Chief, would you know, Chief?
I'd hate to say specifically. Without I can ask my law director if he could give me some advice real quick and get back to you.
That's fine. I was just curious. Thank you. Sorry to put you on the spot.
Thanks.
I would like to ask something.
Dr. Hurt?
Pose it for us to discuss. I mean, my understanding is that citations are a perfectly appropriate way of handling this kind of situation, rather than going to the worst case scenario of putting someone in jail for 30 days. I mean, we've talked repeatedly about that. That's not our goal. That's not our intention. Clearly, education alone isn't working. I'd like to share just a little anecdotal story. I had two of my doctoral students visiting, one from Chattanooga, one from Nashville, last week, and they went downtown to eat, and they were both really surprised at. I mean, they were wondering, like, where's law enforcement asking people to wear their masks? Many citizens and many patrons and many business owners were following the mandate. They were wearing their masks, but there were enough people who weren't. And so they each come, especially the student from Nashville. She said she shared that it's just a given, and it's not really a cause of great social unrest to have police officers, patrolling a public area and issuing the occasional citation with some friendly encouragement and education for people who aren't following the mandatory mask regulation there. So I would like for us to keep in mind that it doesn't have to be an all or nothing. It doesn't have to be we don't have to imagine the worst case scenario when we talk about not us enforcing the regulation, but indeed our law enforcement agency issuing citations. I think there's plenty of precedent to show that that's really not unreasonable, and in fact is acceptable to most people, that without having, to raise the alarm bell about great social unrest. Just an observation that a couple people from other cities shared with me.
Thank you, Dr. Hurt. Comments, discussion?
Just one more education point for me. So what about the repeat infraction? Is there anything different in that? Or is that just handled the same way?
I'm not sure if that's questions directed to me. And again, I'd want to defer to an expert in criminal law, but there's no enhanced penalty under the statute for multiple offenses. I suppose that where you get any more aggressive action would be from prosecutors and a judge if it ever got to that level. You would, a judge is usually much less happy to see a criminal defendant for the fourth time on the same offense as they are the first time.
Understood. Thank you.
I guess my comment would be to I guess first restate that any of our regulations necessarily have to carry a Class C misdemeanor qualification. It's just part of the regulation. And the second comment would be, I don't think that one citation has been issued for the mask mandate, but education mask delivery has been done. And I would hope, although this would be up to law enforcement and be up to the goodwill of the folks in the restaurant industry, that if they were in violation, that they could be educated that this is, against what the regulation is, and favorably respond. That would be my hope, at least the first time, that education, just like for masks, would play the first line of discussion. But that would be up to our law enforcement, both in the city and in the county. Any comments on that? Is that a reasonable approach? It's what we did for masks.
Not to speak for Chief Thomas, but I think that she and Dr. Buchanan will both say, the first thing is not to send someone to jail. The first thing is to educate, talk with them, and then progressively take more aggressive action as needed. But I do believe that both KPD and the health department do try to do their best with the least invasive actions that they can.
That would certainly be our intent. The way the laws are crafted, there has to be a misdemeanor penalty on that. So I would be hopeful that the folks in the restaurant industry would understand our plight and the community's plight and be cooperative and be able to be educated in this manner, but to be determined, I guess. Other discussion, questions about 2020-5?
So just to be clear, so are we not saying what we've always been saying is that we really are hoping for and banking on the goodwill of our fellow citizens' cooperation, but if not, then we're asking for whatever regulations that are in place or will be in place to be enforced.
So Dr. Hurt, I think that the way any of these regulations are crafted, they always carry that misdemeanor penalty. And so that's always there, no matter how innocuous the regulation might appear to be. I mean, it's just the way it's crafted, they have to be crafted like that, as we've discussed. So I think doing the least harm and the most education is certainly the way to start. And then you just have to take it from there. And I would leave that to our city, county officials and law enforcement. I think that would be out of our hands.
Yeah, I'm not agreed. I'm not saying that we enforce it, but that we can rely on the regulations being enforced.
Yeah, they're present, and what people choose to do or not do with them would be up to city administrators and and county administrators and law enforcement. Be my understanding of that. Any other questions, discussion at all?
Sure. Well, a couple things. One is, I know Dr. O'Brien made a friendly amendment. And you did agree, Dr. Souza, to that, did you? Okay, sorry. I got lost. I have a couple of is any more discussion on the substance of the regulation? My questions are not about substance. They're about accuracy of dates and stuff like that. So if you would be amenable to a friendly agreement to change some dates and some like yellow zone, red zone stuff. So on page 1, changing the third whereas, changing the date from August 30th to September 13th, 2020. That was the latest report, and we were in the red zone, not the yellow zone. So would that be an acceptable amendment?
Acceptable.
Dr. Souza? Okay. And then the next whereas, actually, as of, I would say, September 15th, because this dashboard is updated daily. Actually, we're probably still, today's the 16th, actually, September 16th. We are still at the unacceptable threshold. So again, just making it accurate for the date.
Acceptable.
Okay. And then on page 2, the third whereas, again, changing the date to whereas as of today, September 16th, the foregoing authority remains in effect pursuant to executive order issued by the Governor of Tennessee, August 28th, 2020, instead of June 29th.
That's acceptable.
And I believe that's it.
So if that's acceptable both to Dr. O'Brien and Dr. Sousa, we will have that as amended 2020-5. Any other discussion on the substance of the amended resolution? And if there is none, I think we're ready to vote. Any discussion before we decide to vote? Okay, Narda, if you'll run through the roll call for us, please.
Certainly. Dr. Drake,
Yes.
Dr. Gotchard,
Yes.
Dr. Hurt,
Yes.
Mayor Jacobs,
No, but I do very much appreciate the board moving the curfew back to 11 o'clock. Thank you very much.
Dr. O'Brien,
Yes.
Dr. Shemaya,
Yes.
Dr. Sousa,
Yes.
Ms. Wagner,
Yes.
and Dr. Buchanan. Dr. Buchanan,
Apologize, I was muted. Yes.
okay. So that's 8-1 passes.
Thank you. We have passed 2020-5. Item 12 is a draft regulation regarding curfew on alcohol sales. Any discussion on that draft regulation?
That was 2020-5.
Okay, so we can go to 13 then. That's a draft resolution about limiting gatherings, which has been revised. Any discussion on item 13 on the agenda?
I move that we accept that resolution so we can have discussion.
I second it.
So the draft resolution, which would be 2020-6, is that correct, Mr. Sanders?
Yes, that's right. And that's how it's captioned.
Okay. So discussion is open on limiting gatherings, resolution 2020-6. We have a motion and a second, so we're open for discussion.
So just to clarify, the agenda item says resolution, but then this says regulation. So is this a resolution or a regulation?
Authors,
It's supposed to be regulation. I'm not sure how that ended up on the agenda listed that way.
Okay, just trying to clarify. Okay, Okay. And then when I look at page 3 of 5, number 4, I need some clarity. I don't, except as provided in paragraph 6 of this regulation, all public or private gatherings of more than 25 persons, age shall blah, 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 or older indoors within 900, at any. Okay, never mind. I just needed to read it again. I apologize. And then I was a little unclear on number 5. Dr. O'Brien or Mr. Sanders, can you clarify number 5 under number 4 on page 3?
Oh, at least, basically, this talks about having people socially distanced at 6 feet within a certain period. And it also talks about where we have entrance or areas around restaurants, bars, and other establishments where people might congregate. And I'll be honest, that came about with what I saw on the private property of at least 2 of the establishments I saw last Saturday night, where there were large numbers of people, not in a public sidewalk, not out on the street. They were on the property and they were packed in there trying to get into the establishment. And then there were also large numbers of people, at least one of those on a adjacent outdoor area. So that's what that's talking about in that regard. I hope that answers it.
It does. Thank you.
Further comments or discussion on 2020-6?
I do want to say one thing. This does not apply to private homes. Some people thought it did, or residences, places of worship, as we said here, nursing homes, etc. Also governmental facilities. So it's specific and taking that off the table. We're looking mainly for establishments, and we're trying to make sure that the numbers are such in regard to people getting in, people getting out, people out on outside patios and inside, that they're not packed in there. And this is to give, again, law enforcement something to work with. If they go down and see a huge number of people on the strip on private property outside a door, that they can tell them to break it up and or get cited if needed. Hopefully just break it up. That's what we'd rather see happen.
Another question I had after you just said that, Dr. O'Brien, is, and Mr. Sanders, I'm not sure if you know, I believe the governor's also said some specific things about what we can and can't say about funerals and weddings. And so my question is there a need to exclude those? I'm sorry, I didn't even think about that until right now, or I would have found that executive order to be able to talk about that.
I wouldn't think anything like that as a friendly amendment if that's required of us.
Hold on one second. I may actually have it. So hold on.
Dr. Buchanan, you're right. That is in Executive Order 38, and one could certainly amend the exceptions under paragraph 6 of the proposed regulation to include weddings or funerals.
Yes, I think that would be appropriate, as we're limited in our ability to regulate those by the executive orders.
Yeah, and in fact, it's actually the executive order actually speaks of places of worship, weddings, and funerals. So you could probably just plug it right in under 6B. Places of worship, weddings, and funerals.
Okay.
I would accept that as friendly amendment and ask that we do so.
Dr. Drake, are you okay with that friendly amendment?
I am. I second that.
Okay, thank you.
So I have a question to Dr. O'Brien on point number 4, page 3 out of 5. When you mentioned all public and private gatherings, except for people of the same household. And I was just wondering whether this is better for all public gatherings. Private gatherings might be, two related families as an example. I mean, functionally almost like one family. The private part might be, controversial or more worrisome. Go over your logic for private, please.
A private gathering may be let's say a party in a business. So that we're talking about that. Again, we're not talking about private dwellings. These would be more related to a business. So a private gathering, a public gathering, it's something open to the public. A business getting together, there are people after work and having 50 people come to a small area. That's more what this is considered for.
Right, and I would add to that, Dr. Gocher, when we look at the data, we certainly have case after case of people going to an invitation-only event of, however many people are there. And we certainly have cases come from those events. They're not necessarily funerals, they're not weddings, they're showers and parties and other things that people have that may not be in a private home. Where we end up having cases from those events. So again, limiting the number of people that are potentially exposed is kind of the goal. And in those social events, it's really challenging. It's challenging to stay 6 feet apart and wear a mask when you're with your friends. It just is.
Muted, sorry. I guess my distinction would be a private gathering within a private household versus a private gathering at a reception center, convention center, something like that. Dr. O'Brien, is that second option where you're having a private gathering at a public center, is that what you're aiming at?
Yes, the exclusion in 6C says that private dwelling places or residences are not included. So it's purely the other.
So I might suggest, just for clarity, although you clarified it down there in 6, is that private gatherings maybe on public property or something like that, just to clarify that. And that may certainly be a friendly amendment, because I think it's exactly what you intend, but it doesn't, it's not there.
Well, this was, and I have to defer to Mr. Sanders, but it was written this way with that exclusion listed below to keep it kind of clean. So
Right.
That's true. And I'm sorry. And if you limit this to only public property, that's property owned by the public. That would mean parks, that sort of thing. You would not, but as soon as you got into any sort of business that anyone can control, that's private property.
So Mr. Sanders, to clarify, it seems to me that we're using the word private with two different definitions, or two nuanced definitions, perhaps, like private in a privately owned business, for example, versus a private residence.
Well, I think that you're right in that the term private is in two different contexts here. A private gathering is a gathering that not everyone is invited to, or not everyone has the right to attend. And you can have a private gathering on public or private property. That is, you can rent out the pavilion at a public park for your family reunion and have a private gathering on public property. You can also have a private gathering on private property, or you can have a public gathering. Well, you can't really have a public gathering on private property, except to the extent that the owner of the property allows people to come in. But so I think don't get twisted around the axle about trying to continue the word private from paragraph 5 into paragraph 6, or paragraphs 4 and 5 into paragraph 6. Paragraph 4 and 5 is referring to private gatherings. So a private gathering is just a group of people who are being invited to something and the public is not. A public gathering would be on the, something condoned by the government, or a public march, or or something along those lines. Now, since I opened that can of worms, I do need to explain, this would not apply to protests and that sort of thing. The language of the 30 feet of the business was constructed to keep it. People certainly have a constitutional right to assemble for protests in a public park, in front of the courthouse, whatever. There's nothing in this regulation to keep them from that.
And I want to reiterate that the 30 feet was anticipated to be on the private property of, let's say, a business versus sidewalks, rights of way, or streets.
Additional comments, discussion, questions on 2020-6?
Again, my comments are not on the substance, but again, there's some dates that need to be updated. On page 1, the second whereas should read September 13th. So that's the first one. The second one is the second whereas should read September 16th today, because that report comes out daily. And then on page 2, whereas, 2 whereas is above where it says now therefore, whereas as of July 28th, foregoing authority and it remains in effect, blah, blah, blah. I'm just bringing it up to date to today's date. Makes sense to me, September 16th. Offer those as friendly amendments.
Those are all accepted as friendly amendments.
Dr. Drake?
I second it. I second it.
Okay, thank you.
Thank you. So we are still discussing 2020-6 as amended. Any other points of discussion?
Now, one thing to tell people, this is set up as a short term that would need to be looked at on a regular basis. Now, we can leave the date in right now, which is rolling at 2 weeks, or it can be made into 28 days. I did this one shorter, so we would have to look at it and determine if we want to keep going. So I just want to let everybody know that.
So to clarify, Dr. O'Brien, the one we are discussing for vote is going to sunset in 2 weeks.
That is correct. I believe it's on, I don't have it right up here, I think October 1st.
Yeah.
We would have to vote it back in in 2 weeks.
Yeah, that's clear. Any other discussion, comments, questions? Hearing none, since we're ready to vote, last call for any discussion on 2020-6. If not, Narda, if you will go down the roll for us, please.
Yes, sir. Dr. Drake,
Yes.
Dr. Gotcher,
Yes.
Dr. Hurt,
Yes.
Mayor Jacobs,
No.
Dr. O'Brien,
Yes.
Dr. Shania,
Yes.
Dr. Sousa,
Yes.
Ms. Wagner,
Yes.
and Dr. Buchanan.
Yes.
Okay, 8-1, it passes.
So you have passed 2020-6, and that was item agenda number 13. So we're going on to 14, and that's a review and discussion of the Tennessee Pledge and Executive Order number 38. Dr. Buchanan, do you have information, or would you want to lead that discussion for us, please?
This is Dr. Shamia's item.
Oh, Dr. Shami, I'm sorry.
Yeah, no problem. So I don't know, would it be possible, I could try to take over, but would it be possible to project the PDF of Executive Order 38 for the beginning part of this discussion?
We're working on it.
Okay, so I'll start. So essentially, just in further study of both this executive order and the Tennessee Pledge, in specific reference to paragraph 11, the question really was, what is already in place? I think there's this perception that everything out there is simply a recommendation, but in review of this and study of this, this seemed to be more specific. And in several meetings ago, actually one of our first meetings, I think we had said that we were going to default to the Tennessee Pledge where there was not other specific guidance. And for that matter, this is an executive order. Now, not to get in the weeds, but as I understand it, paragraph 11, it's a combination of the executive order 55 and 59 continued this. And so this is still in place. And I'll summarize and then just also ask Mr. Sanders, as I did discuss this with him, but it just says, and we discussed this before on paragraph 11, bars, nightclubs, and limited service restaurants may only serve customers seated at tables, and then must follow the Economic Recovery Group guidelines, which are specifically Tennessee Pledge for restaurants in doing so, including appropriately spaced apart tables, which are set forth in the following web address. And this language, and I'll ask Mr. Sanders, is that it seemed pretty clear to me, may only serve customers seated at tables. And we've had this conversation about standing before. Now, granted, we're now talking about things happening before 11 p.m. But I really pose the question to Mr. Sanders is that is this really optional, or is this also something that could potentially, as it's written right now, without us taking any other action, be a citation type event? And so that was really the point of this conversation, is that if inside, and granted, this is from a monitoring standpoint may be more difficult, and that I need that feedback because this is inside sometimes and not outside. But the idea of just the whole point of socially distancing at a table versus a lot of people bunching in a group. Now, this does get us back to what is a bar and all that. But Mr. Sanders, could you kind of elaborate on your legal interpretation of paragraph 11?
Well, not sure where you want me to start. The paragraph 11 of Executive Order 38, which is continued in Executive Orders 50 and 59, so it's still on the books, states that bars, nightclubs, and what they call limited service restaurants, and those are the ones that you all were defining as bars essentially in prior regulations. That is, they derive 50% or more of their income from alcohol sales versus sales of prepared food. They may only serve customers seated at tables. That means no bar service, and must follow the Tennessee Pledge guidelines. There's no mention in the executive order about how or whether that would be enforced. Frankly, you need to have a conversation with the State Attorney General's office about that. I have no opinion about how one would go about enforcing that mandate as far as the criminal law is concerned. Is it possible that it would fall under the purview of the health director for Knox County? That is an unhealthy action? Possible, but I wouldn't want to state that authoritatively here and now without a lot of research into that issue. But the rule, the Tennessee Pledge, is still on the books. If you go to the State of Tennessee website, it's still the stated rules for the state of Tennessee. The only exception I'll note is that the 6 counties that have local boards of health have the option of either of modifying these rules, or at least this one in particular, either to be more stringent or less stringent. You've taken no action either way on this rule, but this board does have the authority to modify that rule if it wishes to.
Okay, so I guess where I was going with this, and again, I'm not an attorney, but was that a lot of the language, for example, in the Tennessee Pledge is recommend, should. That language seemed more decisive than a lot of what is otherwise there. So, Mr. Sanders, you're saying even if you agree that that's the case, and I'm not sure that you do, but even if you do, there's still not an enforceable element to that unless we were to take some sort of explicit action to formalize that. Do I understand that correctly?
Well, I don't know if it's universally not enforceable. I'm just saying that I don't know the mechanism for enforcement of it. If it is written somewhere that violation of the Tennessee Pledge is, criminal offense, it's in nothing that I have read. And that's why I suggested one would really need to consult with the state attorney general to see what, if any, penalties attached to the violation. The authority of the county health director or health officer is reasonably broad as far as enforcement of conditions that the county health director or health officer feels to be, in some sense or another, I'm just going to say unhealthy. The language is much more legalistic than that. And the health director / health officer carry various abilities to do things in response to such conditions. Whether these would qualify in those conditions is I'm not sure right now. I'd have to consult with her and talk with her and take a look at some research and probably call the AG's office myself to see where the matters stand on this. But it certainly appears, I think what you're saying initially, does this language appear to be more mandatory than simple recommendation? Yes.
May I speak to the practical side of this?
Yes, please.
Practically, this is not enforceable.
Yeah.
My staff is out there educating, and getting yelled at and cursed at, and the animosity is unbelievable. And so I'm not willing to put my staff into that position any more than they're already in that position. If this board tells me I have to, I will do that. But just so you know, and it's not just my restaurant staff that are getting yelled at, it's my phone bank, it's my epidemiology staff. And the more we push that, the more we poke that bear, the more animosity is going to be unleashed against my staff. And I feel like I have to stand up and protect them a little bit. If we were like Nashville and we were able to actually trace cases to these locations, that would be very different, but we haven't. And I'll just be honest, there are restaurants that are not complying with this. And my staff have been out there multiple times, and some of them have been forced to tears because of how they've been treated in trying to enforce this. And so it's just one of those things that, you have to choose your battles. And right now we really have to choose our battles, to be quite frank.
Understood. And so, Dr. Gocher, I think given that, and it sounds like there's not enough there to, for example, use the approach that we've discussed earlier in this meeting. I'm not sensing, unless, obviously this is open for discussion, that's an option. And I certainly understand what Dr. Buchanan said. I'm not sure there may be more to do with this other than to convey that, we have to just keep reminding that we did default to the Tennessee Pledge. So this expectation is there, but I guess as Dr. Buchanan said, maybe this is a choose what to focus on. And I don't see a practical path tonight to focus on this, but I'm happy to either you guide the discussion and let it go in whatever direction it needs to.
Right. And what I'll say too is that for the most part, the establishments in Knox County are doing this. They can serve seated people in the bar. They can't have bar service at the bar. People don't stand at the bar to get drinks. They're seated in the bar only, and the bar is used to just serve seated patrons. And most places are doing that. There are a few exceptions, and those are the ones that, my staff has repeatedly dealt with. And there aren't very many of them. Most of them are following this guidance, and we really appreciate that. I don't want to make it sound like everybody out there, it's not the Wild West. For the most part, people are following the guidance and abiding by the Tennessee Pledge.
I would like to contribute something, it's just a thought, but in Dr. Buchanan, I just want to say on behalf of all of us, thank you to your staff who really are on the front lines every day. What I'm wondering is, and so I'm thinking aloud, but I'd like some perspective here, some ideas. If we have adopted the Tennessee Pledge, then it's my understanding, I'm not a lawyer, is that whatever we adopt as part of the Tennessee Pledge is enforceable. What I'm wondering is there not a way to support your team, Dr. Buchanan, with, for example, when we've been talking this evening about KPD enforcing the regulations, is there a way that they could support your staff? And I'm really, truly just wanting to talk about that. I'm not proposing anything, but I'm just wondering if that might alleviate some of the stressors on your team and reinforce what I think Dr. Shamia is trying to call to everyone's attention, which is we've adopted the Tennessee Pledge. This is something that in our understanding should be enforceable. What are y'all's thoughts?
And I don't want to speak for law enforcement, but my staff works with Chief Thomas and her staff on a regular basis on lots of different things, and with the sheriff as well and his staff. And we pick and choose when we have our law enforcement friends help us do things for many reasons. We don't exercise that authority unless we really need to and feel like we should. And so it's been one of those challenging things in this pandemic. I will say that if I recall correctly, way back when all the executive orders started and the Tennessee Pledge started, the governor was pretty clear. It was not his intent that these would be regulations that would be enforced. And as a matter of fact, across the state, in other counties, that certainly isn't happening. Again, I go back to, if this board says you want us to do something more aggressive, we can certainly consider how we would do that safely and effectively for the few establishments that need more than a reminder.
Dr. Shamia, any other discussion?
I believe Chief Thomas has a question or a comment.
Oh, great.
Thank you. I just want to say that to Dr. Buchanan that we certainly appreciate all she's done. I know that I eat out on a regular basis with my family, and she's right. Most people do follow those regulations, and we are more than happy to support her whenever she has an issue and willing to work with her. And I think your previous regulation that you just passed allows us to go out without them and enforce that in a pretty direct manner with the less than 25 people and the 900 square feet. So I appreciate all that Dr. Buchanan and her staff has done, because that laid a lot of the groundwork for us, makes it easier for us. So thank you.
Dr. Shamia, any other points of discussion or any points of discussion regarding the Tennessee Pledge from the board or guests?
Dr. Gochard, I'm at peace with the discussion, and just to reiterate that we still just need to keep, if nothing else, just reminding and reiterating the parts of the Tennessee Pledge that are not specifically in something else that we've passed. But otherwise, I appreciate the discussion, and I don't recommend any further action tonight.
Thank you. So we are at other business. Is there other business to come before the board this evening? Dr. Buchanan.
Just a quick question. The County Commission lists the sponsor next to any regulations or agenda items. Would you all be comfortable with us listing the sponsor on the agenda, like whose regulation it is or whose agenda item it is? That sometimes gets a little confusing once we get the agenda printed and you know who's kind of carrying the ball on that one. Would that be okay with everybody?
Kind of as an open discussion, any thoughts to the contrary of having your name on that regulation that's been proposed or voted on?
Is this something we're asking that would have to be like formally incorporated into our newly passed rules? This is just a point of process that I'm asking.
I don't think it's in commission rules, but it is standard operating procedure for commission.
I can't imagine why we, and someone help me out here, why we wouldn't want to do that. It seems for clarity, it would be helpful.
Yeah, I mean, it's really just about clarity and like, you know, so, you know, who's going to take the lead and who's the sponsor. And so if everybody's okay with that, we'll start doing that just for some clarity. Okay, thanks.
Any other business? If not, I've got two comments. One comment has to do with emails, and this is kind of for the public so that there's just some clarity on this. We started out before we had, as we were in the process of organizing, before we had our designated Knox County .gov email addresses. We had other email addresses, and I would certainly want to have all email communications addressed to that. It's just simpler for us who have other professions other than being on the Board of Health to segregate these things out, because if they go to, for example, your UT box, it's going to be confounding and cluttering and such. So if, I mean, that's where those comments are supposed to go, and we all have an email dedicated to that. So that's just a suggestion or wish to the community. You may have these other addresses. That was not our intention that they be used for that purpose. It's not, it makes our daily lives a little more difficult. And if you can take it through Knox County, that would be wonderful. So that's point number one.
Dr. Gocher, can I make a quick comment on that? I think for that very reason, the emails are, at least for me, are more likely to be read if they're in that Knox County because if I'm in the middle of other work, then I just will try to get to my next work email versus setting specific time aside to read these emails. And so I think it's also, it's not just a convenience, they're more likely to get read if they go to that knoxcounty.org email address.
Agree, totally.
And I think we've run into, you know, sort of a lot of these lately for whatever reason, I don't know. But anyway, if the public could help us and accommodate us there, it would be greatly appreciated. That's for sure. My other comment is this. These are really tough times, and voices from the public have become increasingly strident, worrisome to the point that maybe interpersonal violence might even be an outcome here. I worry about this every day. And, you know, I just want the public to know that we are really people of good faith in trying to do what's best for the community. And we understand all of these concerns. It's a very worrisome thing each time we have to pass anything, not done lightly, done with a lot of reflection. And sometimes I feel we're out on an island. I've certainly, I think, felt a little more support this evening as we talk to people. But honestly, sometimes I feel like the legislative branch, the executive branch, and and the judicial branch are all just letting us carry on in singular fashion. It's a little scary. So any other comments on that from everyone? If not, if there's no other comments today, we can accept a motion for adjournment. Comments about any of that?
Dr. Coach, I think it's also true of Dr. Buchanan and her staff. They work hard, and in many cases, they're just doing their job, and they're doing it in difficult situations. And the issue to me is the structure of all of this, and the fact that the way this board has been put together, the way the Tennessee code reads, and all those things, this is a very, very bad situation for everybody politically, and that's an issue that folks really need to talk with their state representatives about. You guys have been put in, whether people agree with you or not, you all have been put in this situation, and you do have to exercise your judgment to do the things that you're doing. That's what the law says. So in the end, I would much prefer that people realize that their anger needs to be aimed at the system that has put you all in this position and not you all. Because I agree, despite the fact that I often disagree with the decisions that come out of this board, I don't believe that they're being made in bad faith. And I do believe that you guys have the best interest of the community at heart. So that's just my 2 cents.
Thank you, Mayor Jacobs.
Oops. Thank you, Mayor Jacobs.
Yep, thank you, sir.
Thank you.
Any other comments, discussion in that other business? And if there is not, we'll accept a motion for an adjournment in a second.
So moved.
Second.
Thank you all, and we will be meeting next week at 5 o'clock again. Thanks for everybody's help, participation. Thank our guests for their very valuable input as well.